Hello and welcome to the Health and Wellbeing Board meeting today on the 9th of July. Thank you for those of you that have been able to come despite the harsh weather conditions. As you will be aware from a couple of emails I've sent you all previously, Councillor Bearder has sent apologies for this meeting, and his preference is that Councillor Gall chairs this meeting, and that Councillor Gall also chairs future Health and Wellbeing Board meetings on a more permanent basis as well. But given that the terms of reference of the board have not yet been amended formally so as to allow a cabinet member to chair, the advice is for the members in the room today to elect Councillor Gall to chair today's meeting, please. So are members happy for Councillor Gall to chair the meeting?
Oh, yeah. Thank you, everybody. I guess a couple of pieces for an update. My style of chairing will be very much a partnership piece, and I'll be really keen to understand what the priorities are for board members. And my view would be that the chair is not the be all and end all. The chair is the vehicle with which we need to feed these priorities through into a work programme, into future agenda items, and into a space that we can have a good old poke and prod around and ultimately try to improve the lives of the people we're here to represent. So onto the script. Health and Wellbeing Board does not currently have a vice chair. OUH have recruited a new chair who is in the process of being onboarded at the Trust. They will become the new vice chair of Health and Wellbeing Board at the next meeting in September. Next to that, the all-age autism strategy has now come to this meeting for full and final sign-off. The delays were partly to allow the strategy to be discussed at HOSC prior to its formal sign-off at Health and Wellbeing Board. So the background to this is we had a mismatch of the order with which the all-age strategy was working its way through. And what's really important is HOSC gets the time and the space to be able to scrutinise these really important strategies before they go to sign-offs at either Health and Wellbeing Boards or Cabinet. I plan to be working really closely with the chair of HOSC to make sure that that would be the order that we take things as a natural occurrence, so that we don't have the bumps in the road. The third note to make is we do have a neighbourhood health plan item at this meeting, although this would again be for the Health and Wellbeing Board to note the ongoing work to develop the plan as opposed to signing off the final version of the plan. And again, in keeping with the principles of HOSC having the opportunity to do their work, to scrutinise strategies and plans and programmes before they get signed off, HOSC is going to have the neighbourhood health plan in November, I think it is. Yeah. And the chair of HOSC has just highlighted with me that HOSC would be really keen that things like geographical boundaries are not set in stone before HOSC get the opportunity to do their work. And once HOSC have done their work, then it will come to us for the eventual sign-off, and we'll be in a place that will be fully open-eyed on it. Agenda item 2, apologies for absence and temporary appointments. So we've had apologies received from Councillor Lisa Smith and Chair of District Council, and Councillor Rob Pattenden is substituting, so thank you very much. We also have apologies from Lisa Lyons, our Director for Children's Services. And do we have any others, Omid? No? Is that Barbara? Yeah.
So there was apologies from Veronica as well.
But thank you. Veronica's not a formal member of the Health and Wellbeing Board.
Right.
So those
they don't
fall into the category
okay.
of the same kind of apologies.
Councillor Heritage?
I was also just going to note that Councillor Rachel Crouch is no longer a member. She's been there's now a new member whose name I'm just looking for on here, but Councillor Crouch wouldn't expect to be here today.
I think Councillor Lisa Smith has sent apologies.
Rob Hassenden
Yeah.
is the substitute for Smith.
Okay.
Okay. Any more on the apologies front? No. So, agenda item 3, declarations of interest. Do any members of the board have any interest to declare? No. Agenda item 4, petitions and public address. We have no requests to speak from members of the public. Agenda item 5, minutes of the previous meeting, which was on the 14th of May. So for those that were at that meeting and are here at this meeting, we need to approve the minutes. So I'll take this in the usual manner where I'll name the pages. So we've got page 7 of the published agenda pack, page 8, page 9, page 10, page 11, page 12, page 13, page 14, page 15, page 16, page 17, page 18, page 19, page 20, 21, 22, 23, 24, and page 25. Okay, do I need to physically sign minutes?
Oh, outside the meeting.
Okay, good. So, agenda item 6, we've got 30 minutes allocated to the all
I
age.
think the members actually need to approve
Ah,
the minutes.
good point. Do we approve the minutes? Excellent, thank you. I sort of know what I'm doing. The all age autism strategy. So is it Bhavana? Yeah, Derek and Dee are going to help us with this. Did you want to? Yeah, please do. I'm going to hand over to Karen.
Yeah, brilliant. Really, really pleased to be here to share our all age working strategy. And again, I think it sets out our shared ambition to make Oxfordshire a place where where autistic people of all age are respected, understood, valued and supported to fulfil their lives to their maximum. So I think this has been on a journey, and I think it'd be fair to say from the strategy perspective, and I think for those that have worked with me for a little while will know that when we first started it, we didn't get it quite right. So we paused and we went back to the drawing board and started it again. And I think I want to formally thank, we've had some incredible people working alongside us and from the county, alongside the county council. And I think Dee is one of them who sat here, is going to speak to it as well. And I think it has been, it's been a learning journey, but it's also been an opportunity to make sure that we do get things as right as we can. So again, I just want to formally put that on the record. Our thanks from the County Council for this piece of co-production. So without further ado, I'm going to hand over to the team because I know they're going to take you through a few slides, and then we've got some opportunity for questions. Thank you.
Right, I'm just going to get the slideshow going. Yeah, it worked. Sorry, my buttons weren't actually going as quick as I like them to. So thank you all for giving us the time to talk to you with reference to the all-age autism strategy. The purpose of this presentation is going to be a brief summary of the main document that's in there at the moment, and we've brought it here for the purposes of seeking endorsement, approval for publication, and the implementation of the strategy and the further work that's required. And obviously we'll bring it back to Health and Wellbeing Board for updates in the future or as and when required. So the recommendations to the board is to endorse the Oxfordshire All Age Autism Strategy. It'll run from at some point in 2026 through to 2031. Approve its publication and implementation once we've finalised the final version in co-design with people with lived experience. Agree the contents and principles that are set out in the strategy in terms of the themes that we wish to cover. And we just want everybody to note with reference to the decision around local government reorganisation that this may change the journey, or we might need to change depending on the decision, the way we deliver this as we go forward. But the intention is to continue the great work and strengthen partnerships as we go along. So why is a strategy needed? So we know there's long waits in diagnosis. The communication while people are waiting isn't always the best of communication, and this is what people have fed back to us. There are fragmented services and difficulty for people to access those services and not knowing where they are. And there's barriers within education and young people services for young people who have autism or are autistic. We know there's issues with employment, housing, and other parts of the general social sector. There's inconsistent understanding of autism, so and reasonable adjustments in terms of what we need to do to work with individuals who are autistic, and understand what it actually means to be autistic as an individual as we move forward with the delivery. And we know there's health inequalities generally in the system with poor access to certain services. So it's about working with those partners and making sure there's coordinated support. So the report then goes into how we develop the strategy. So we've shaped it through consultation, engagement, co-design. We've got autistic individuals involved in the delivery of the strategy. That's the development of the strategy. That's both professional and experts by experience. We've got Dee here, who's a co-chair with me on the Autism Implementation Board, which might change name at some point. Which is the overarching element of this. We've done some public consultation around the strategy, and we've got an organisation, Sky, to actually do some needs assessment for us in terms of understand what our gaps are. And we did have an event on the 4th of December, which had over 100 people there, but overall we've consulted, and over 200 people have contributed to the delivery of the strategy, the delivery of the document, and development of the document. As I mentioned there, we did have a big event on the 4th of December, and we want to continue doing things like that as we progress the implementation of the strategy. So in terms of the work we've done, these are the 6 key areas. I'm not going to read them out. They're all in the document itself. And the 6 areas will have subgroups that will deliver each of those areas, which will feed into the Autism Improvement Board. So what does the strategy aim to achieve? So one of the key things is reduce the diagnostic wait. So in terms of how do we manage individuals on a waiting list, improve their pathways, their health and well-being, and look at how people can wait well if they are waiting for a diagnosis. Expand the employment offer, so work with organisations in terms of how they work with individuals who are autistic and open up more opportunities for them. We want to strengthen the education and SEND practice, so that's working with what's being provided at the moment and how that can be enhanced. And then prevent unnecessary hospital admissions, because I think we can tap into a lot of local resource and make things better for autistic individuals so that they don't end up in hospital and able to look after themselves. Improve the reasonable adjustments across the service. So that's again working with VCSE partners, community partners, as well as our health organisations in terms of what's being provided, and making support clearer. And one of the things we're doing as part of the delivery of the strategy is having a resource which Dee is going to support with, and we're going to co-produce that bit in terms of having a website and a resource where people can tap into in terms of support they can receive. So the principles underpinning the strategy is obviously we've co-designed at all stages, and it's like Karen explained at the earlier stages. We did have to pause at some point because we didn't feel as a collective there was enough co-design, but we were able to get that back on track, and we've got good representation now. It's to underpin the trauma-aware practice, so understanding the trauma autistic individuals go through and having practice that works around that, removing any barriers, and that's environmental as well as social barriers for autistic individuals, and making sure that people change their practice in general, and in terms of having an open door for individuals who are autistic rather than excluding them from services. It's about using more affirmative language, which is neurodiverse, as well as being respectful to everybody for whoever they are. Moving away from functioning labels. So rather than saying this person's autistic, look at them as an individual and their qualities as we move forward, and make it more asset-based rather than deficit-based, and promoting autonomy, safety, belonging, and dignity, so that people who are autistic feel part of the community rather than feeling they're unable to access certain services or interventions. So then what does the strategy aim to achieve? So have I just done that? I'm just sorry, my screen flickered, so I thought the slide changed. Apologies. So the principles underpinning, just went backwards. Sorry, it went backwards twice. Apologies. So the governance. No. So governance, delivery, and accountability. In terms of as mentioned before, it's overseen by, the delivery of it will be overseen by the Autism Improvement Board, which is an active board and is there generally in terms of delivery of best opportunities, interventions for people who are autistic and looking at what's around. The board is actually co-chaired by myself and Dee at the moment, but the co-chair, although I'm a static co-chair on behalf of the organisation, the person with lived experience co-chair will be rotating and will look at reviewing that on an ongoing basis. The membership of the Autism Improvement Board brings people with lived experience who are both professional as well as carers, family members, and other experts by profession within that sector, and as well as our partners, so health partners, VCSE partners, community organisations, and we always have a theme within that which we work with. And the board will monitor the progress and monitor risks, so there will be a risk register and so on, and there'll be a shared accountability against all partners, although it will be, because it's a council endorsed strategy, it'll be oversight will be with the local authority. In terms of assurance, risks and key considerations, assurance obviously will provide, there was assurance provided to HOSC back in April 2026, and we've been able to apply a lot of the, well, not a lot, all of the recommendations to the strategy. So the document that is there as an appendix has got all of those recommendations addressed within that. And the risks and mitigations, we will have a risk register as part of the implementation, which will monitor on a regular basis and look at how we mitigate risk, overcome risks, and also deliver positive outcomes for autistic individuals. So decisions and next step, I think this is the last slide. So the strategy provides a clear framework for improving the lives of autistic individuals of all ages and their families and carers and friends and the social networks. It has been co-designed and shaped with people who have lived experience and experts by experience, and it's the local evidence review. So although there's a national strategy, we didn't just base it on the national strategy, but we based it on local evidence as well, so it meets the demographics of Oxfordshire. It sets out the 6 priorities, which I mentioned earlier, and for system-wide action, and it provides the governance through the Autism Improvement Board and thematic delivery groups, which will sit underneath that, which will be 6 subgroups, which will have individual chairs on those. That's it.
Thank you. I can see Karen's wanting to come in.
Yeah, so thank you. I think before we move over to questions, it'd be really helpful probably to hear from Dee, because I think as somebody who has been absolutely instrumental in working alongside us. So if Dee, I'm sorry to put you on the spot, but any, I know you do, you're very passionate about this, and you'll be good to have a few words, and then we go into questions and answers. Thank you.
This is where Derek and Bav go. No, but it's amazing, because actually we've had to work quite flexibly, in a way that there's been times when I've been challenged and I've had to kind of challenge back, and that's been a thing I think that I have really appreciated. I think the last time I was here for HOSC, we talked about power and how power influences strategies like this, and how those of us who are not within statutory services are how we're positioned. And I think that's a really big thing. I'm very privileged. I'm privileged by my education. I'm privileged by the role I hold now within my own company. Like, I built a company based around the fact that I'm autistic. I'm privileged because I'm white. You know, I'm privileged because of all of these different things. And I suppose one of the things that kept coming back was, do we have the right people in the room? Are we hearing all the voices? And we know that we're still not hearing all the voices, and that came up at HOSC, didn't it? That actually we're not hearing everybody's voice. And of course, we're not going to hear everybody's voice, but do we have enough engagement from those whose voices can be very, very regularly missed? So that's something for us to just always hold in mind. I think the whole process has been both incredible and exhausting. I think there were times when we think about trauma-informed practice, I think when working with a community like the autistic community, this is really, really important. And I'm very much coming from a systemic lens. And I think what we have here is a possibility to really shift a system. And actually, I'm like Maverick, I get it. You know, I'll say things in a meeting where people are like, oh my goodness, like tumbleweed. I'm used to it now, but there's something here about how do we own this piece of work, because it's slightly risky in a sense that we're asking people to change, but we're not asking the autistic person to change. We're actually trying to hold a mirror to services to say, this isn't okay anymore. It's really not okay anymore. And it's like this, it's a human rights issue in one sense, because if you look at Leader, if you look at Stomp Stamp, if you look at all of these papers, autistic people die younger. And the like trigger warning, the suicide rates among autistic people is higher. You know, if you look at the alternate provision numbers, the percentage of autistic young people out of education is the highest. We have information here, we have data that we have to shift. And I think this strategy is a really good start, where I will be constantly poking for is that there is action. And action talks about buy-in, and that's why we're here. We need people in power to buy into this, and then to hold, well, for you to hold the heads of services accountable, and then for us to be able to kind of go and say, this is an idea we have. And we're not talking about everything changing, because that's very, very idealistic. I get that. But I think there's something here about really, really owning the fact that something has to shift. And there is so much going on already in the county. one of the first things we're going to do, we're going to get onto the you'll see if you've got the first year plan, but one of the first things we're going to do is we're going to do a beautifully autistic kind of FBI CSI mapping. You know, that lovely grid thing where you just go across the county and we go through each tiny square and we work out what's already in place. Because actually there's loads of stuff in place. People are doing amazing work, but it's not joined up. And the wonderful thing about an autistic brain is that we can see connections where connections cannot be seen by others. So that's a beautiful piece of work. And that's part of the website. That's part of one of the resources to come out of it, is there's this idea that we are going to really celebrate what's already happening. And then with that, we have resources already in place to do something to support the changes we need to make. Yeah, I didn't badmouth anything. This is quite good. No, I think it's just been such a hard process. It has been grueling, and you can both attest to that.
It has, but I think healthy challenge.
Yeah, we're still here and talking.
Yes.
And I was invited today, which is a good thing,
we even
right?
tried to meet for coffee.
I know.
But no, it's been very challenging, but I think change often is.
Yeah, but I think there's something coming from, when you're coming from the lived experience position, when you're coming from the outsider position, it's extra work, isn't it? To have to come into meetings and where statutory services are involved and say, and it's just constantly having to take that risk. And that is exhausting. I'm done.
Thank you, Nick. And we are genuinely glad you took that risk. And I think please don't ever apologise. I think the challenge that you've given us is a really healthy challenge. And actually, I think as an organisation, I think particularly from the autism strategy, when I first came into post, we haven't had one. It's over 12 years out of date. And I think so the fact that we've actually got on, done this piece of work and actually navigated what it hasn't, I think you've heard today, it hasn't been the easiest of pathways. However, the fact that we're here, we're presenting a strategy that has been co-produced and agreed, I think is testament to the hard work. And like I said, thank you for our challenge because we needed it.
Thank you very much. So to all of the speakers, but Dee in particular, your enthusiasm is quite infectious, and I'm quite excited about this piece of work. And I'm also, recognising the fact that this is the final sign-off point, right? So this is the bit that it's either got to be right or it isn't. But I'm sensing from you that you think we're in a good place with the strategy, is what I'm hearing.
I think, yeah, it does have to be right. But there is a point where we just need a strategy. And then what happens next needs to actually happen. Yeah, we can have a strategy till the cows come home. But actually, if it's not a working document, if it's not actioned, then there's no point. So again, that's great. We get it signed off. But for me, then it's that impetus to actually do something with it. But yeah, let's get it signed off. It's a good document.
Yeah, so and just to add to that, so the strategy, I always feel a strategy shouldn't be a document wrote at the start of the journey and that's it, it sits on a shelf. It should be dynamic, it should be evolving, because there's going to be new emerging trends coming out that we need to consider. Hence why the delivery plan, where we haven't wrote an action plan and delivery plan that runs through till 2031. We've done a 1-year delivery plan, which is dynamic, and that will change as we go. And that will then determine what we put into year 2 and so on. So the aim is by the time we get to 6 years, you'll be able to look back and say, actually, yeah, there was 6 years or 5 years worth of delivery plans, and this is what's happened and this is what we've achieved.
Thank you. So I do have some personal questions, but I'll open this up to members first of all. So who wants to kick us off? Yeah, Councillor Passenden.
Thank you, Chair. And yeah, thank you for the presentation. It's really, really interesting, and sort of I guess for me highlights a lot of things that I don't think about. And in a way, it's kind of inspired my question, which is slightly separate to this. In my other hat, in my day job, I've got a business. I employ people, and you talk a lot in the report about employment and opportunities and all this kind of thing. And I was just thinking about how it's possible to get them. You might come into my workplace and say, well, this is not set up in a way that is, conducive for having autistic people working there. I don't know that because that's not my area. And it sounds to me from the report that you're talking about breaking down some of those boundaries and saying, actually, autistic people can come and do a fantastic job for you, but you need to make these sort of minor changes and what have you. So I guess my question was, at this stage, has there been much thought about how that would be sort of rolled out to maybe to the private sector, or I suppose public sector and just employment in general, but that reach out to employers really is what I was looking to find out about.
Sure. Yes, thanks for that. So the thought around employment we have had, and what we've talked about is the potential to have almost like a chartered kite mark for employers that we can work with and look at where they've made reasonable adjustments and everything else, and the offer of support and training, etc., and things like that around how you potentially manage some sort of challenges around neurodivergence. So we have considered that. It's part of what we would expect to be delivering across the lifetime of the strategy itself. There's already really good pockets of work, as Dee mentioned already. So there are already things that we know are happening in Oxfordshire that we think that we can sort of piggyback onto, and potentially not have to reinvent the wheel when we come to sort of delivering some of these changes. But there are also things that we can do without too much information having to be relayed. So you can consider how you do your interviewing process, for example. Is that designed in the best way to get the best out of an autistic individual who might struggle with instant challenges? Can you send the questions out 2 or 3 days ahead of time, potentially? And that goes to everybody. So you're normalizing the field rather than providing something that's set aside for an autistic individual. So it's more about how do we normalize the field so that it's equitable for everybody. When I might be able to respond to a question really quickly, but an autistic individual might not. And I wouldn't be worse off for having the questions ahead of time, but an autistic individual may well be significantly better off. So it's those things that we're kind of looking at, and we talked about the sort of the autism website that we put out there. So this kind of information hopefully will be Oxford based and it will be accessible. So, yeah.
I think Dee wants to answer as well. Please do.
Just a couple of things. Like there's a whole lot of work going on. The DWP have a regular monthly neurodivergent working group, which I know Chris Bailey is running, and that's a brilliant space. There are a lot of B Corp CICs, charities across the county that are doing work neurodivergent. However, if we're able to kind of take some of that learning and work with them to build partners, and then to be able to kind of take some of that learning and then kind of make it accessible to people. I think there is a place where this kind of website will be a go-to for resources. Really, really helpful. But I think there's something here about understanding how we shift away from this inclusion model. And I think this will go across all areas. I know education is a big thing, but within the workforce as well, when we're including people, we're thinking of them as othering, right? So I think we need to really move away from that and start thinking about equity, and mattering and belonging. So when I'm in a space where I matter, I will be much more able to engage. And lots of times we tend to kind of aim autistic people and those with learning disabilities towards catering, social or bar work or that kind of work, or hairdressing, and I'm like, oh my goodness, how did we get there? How did we get to the point where that's kind of what we thought? So it's just ever so slightly shifting some of those kind of narratives, and I think just asking the questions is some of the big thing. And I think there has been a fear of not being able to ask a question, and I think that requires some thought, because for me, you can ask me anything and I will be okay with it, but this is my special interest. This whole piece of work this is what I love doing. So again, it's about how do we ensure that when we want to get the information, that we're actually looking at the right sources. And we know there's a whole lot of misinformation there as well. Thank you.
Thank you, Dee and Derek. So Karen's going to help finish the answers on this, and then we're going to move on to other member questions.
Yeah, so thank you. That's a really good question. I think, it's really important that we work with businesses across the county, and through our Connect to Work scheme that we are going to be running. Again, this is where they can link in really, really nicely together, because I think that is absolutely about how we can work with employers, but actually supporting people who otherwise would struggle to seek or get secure employment and actually have a sustainable employment. So as we move forward, so I would welcome anybody or any business across the county that would want to be part of that, and we've got some absolutely brilliant partners within that space. So I would encourage members to have a look at that Connect to Work piece of work that we're doing.
I think Ansaf also wants to come in briefly, and then I'll bring in Councillor Crouch.
Yeah, no, thank you. And I think, I mean, it was really powerful listening to you in HOSC. So thank you for doing this again. It's really, really important. Just Karen's conversation about Connect to Work made me think about we're a Marmot County, and I know it's the next item on the agenda. And that means tackling inequality in every sense. We've picked up 3 themes under that. One of the theme is employment and fair employment and training and things like that. So there's quite a strong parallel between that theme and what Karen just articulated. On the back of that, we had a business engagement session, and it was all about how do we give opportunities for all groups in a very inclusive way. How do we give work experience opportunity in an inclusive way across all? And I'm not talking specifically about autism, I'm talking about autism and neurodivergence and mental health in that kind of broader sense. How do you give that opportunity? And actually, that's how you really improve the health and well-being of those all communities. And actually, if we are going to talk about growth and economy and things like that, how do we do that in an inclusive growth way? How do we bring everyone from people from areas of deprivation, people with neurodivergent, people with autism into that employment space, into that training space? So I think we have a great opportunity. We've just kicked off, and I feel like I'm going into the next agenda item a little bit, but I think we have a great opportunity on the conversation we started around business engagement, around thinking about how does this all autism strategy link up with Marmot and link up with giving those opportunities for neurodivergence as a whole.
Well, I think if we get it right for autistic people, we will get it right for everybody. I really, really do.
Really exciting to hear.
I think if you can hold that in mind, then, could an autistic person access this?
Thank you. Barbara, can we bring you in briefly, and then we'll bring in some other members, please?
Thanks for the presentation. Just as good second time around, because I also, heard you present at the health overview and scrutiny committee. Excuse me, my voice is going a bit. I just wanted to know a little bit more about what your first thoughts were about how you were going to raise awareness of the strategy, how you were going to sort of get the information out to people, and who your target audience is going to be.
Okay, so I'll start there, and please, Derek and Dee, add to that. So in terms of, so once it's been approved here, fingers crossed, all goes well, we'll get together as a working group and discuss launch date and an implementation start date. That will be potentially through a website which will be initially Live Well Oxfordshire. There'll be appropriate communication in the press with reference to that. In terms of who we're gearing the communication to, it's everybody. It's not just certain individuals. We want everybody to know about this. And we're hoping that we'll have a launch event as well, where people can come along and speak to people who are autistic, as well as the professionals who will be and partners. We can all speak to each other in terms of the launch of the strategy. So for me, the communication is everyone, and the launch is with everyone. There is going to be an easier read version of the strategy, because I'm sure there's people out there who don't want to read pages and pages. So it'll be like a strategy on a page or 2 pages we're aiming to do, which will also be launched soon after the main document is. And the key part of the year 1 delivery plan is the website. So this is the website where everybody will have access to, either via the Live Well Oxfordshire website or directly. And that will have the most up-to-date information about the strategy, documents, what's going on, local initiatives people can tap into.
Thank you. Right, every so often a chair needs to be a mean chair, and I'm conscious that we're 40 minutes into this discussion and there's still more member questions. So I've got Councillor Crouch on screen, then Councillor Heritage, and then Councillor Gregory. Councillor Crouch, please.
Thank you. Can you hear me okay?
We can.
Yeah, thank you. Okay, first of all, I'd like to say thank you for the presentation. Thank you for the strategy. I've got a huge interest in this specific field. The bit I want to ask is, my question is, strengthen education and send practice. I wasn't sure whether you meant people's knowledge of this or whether you meant the service. And that was my first question. If somebody could answer.
Who wants to take that?
I
Dee?
think,
Or
well, I think it's a bit of both, actually. But you've got the SEND reform going on already, which is we're going to be aligning with that. It's absolutely the idea of the same language going along through, the same golden thread. So it is about upskilling the workforce, but also ensuring that the correct provision is in place. And we know that that's going to be a massive job, and that is not a outcome that we're going to be able to get through this strategy. However, just constantly having that conversation and bringing it back to the front of, is this right? Are we doing the right thing? I was just in the AP steering group meeting, and their strategy is really geared towards this idea as well, which will align with the SEND reform. So I think it's a bit of both.
Councillor Crouch, does that answer your question?
Well, I've got a second part to my question, which
Sure,
follows.
please do.
That was a great answer. Thank you so much. I want to take you back to 6 to 9 year olds. I was a primary head teacher for years at St Nick's in Oxford, with a space with children with autism. So I've got a bit of an experience of this. I know for a fact, having personal with my grandson, there are children out of school with autism with their EHCPs. They have not been in school for years, a couple of years. That's where I want to just say, I'm really pleased that you've got this strengthen education and SEND practice. I think we need to almost get back to there to see this is where we need to get the support to begin with, because everything else you said is absolutely brilliant. But I think we need to have these children in school, and there is a gap there, and that's nobody's fault. It's just the system as it is. So I just want to put that out there. So thank you, and it's a bit of a moan, but not at you guys. Okay, thank you.
Who wants to take this? Bahana?
I can take that. So we do have the children's service. Unfortunately, Lisa has sent her apologies, but this is an all-age autism strategy. And in terms of our working groups, our improvement board, we have people from children's social care involved with that. So we've got a representation from SEND, we've got representation from CAMS and the education services there, as well as social work members who attend the working group and who have helped us develop this strategy. And there is a commitment there to actually look at current practice and look at how we can jointly look at making that experience better for younger people.
Thank you. Yeah, thank you.
Dee, please.
This will be on the risk register, because we know that this is a barrier. This is a massive barrier to young people, to anybody accessing education if you're autistic. And like I said, the percentages of autistic young people out of education are the highest. And then what we find is then we have co-occurring mental health difficulties, which then things get entrenched, and we have family breakdown. It's an awful situation. And I think there's something here about, and this is part of where I get very excited, is this mapping of what's going on, what's working, and where the gaps are. You know, where's the data around why are these young people falling out of the system? And most of the time it's because their needs are not being recognized early enough. They're not being identified early enough. So actually they're being pushed to the point of crisis. So then they become unable to access education. And then we have the knock-on effect on mental health, family breakdown, all of that kind of thing. And we have to also recognize that when a young person is out of education, parents struggle to work. So we have an economic impact as well. So all of that is very, very tricky and messy and all of that. And it's just having those conversations and being able to look at what the gaps are, and really quick wins. There are a lot of very quick wins. And hopefully, alongside the SEND reform, we've got the AP strategy, all of that. But it is about joint working. And that's something that has been a barrier to anything moving forward, is people are not talking to each other. Beautiful position outside of strategy services. I'm just like, well, but so it's bringing all of that together, and that's where the mapping is so key.
Brilliant. Thank you.
Thank you. And thank you, Councillor Crouch, for the question. Councillor Heritage.
Thank you, Chair. Actually, my question's a little bit defunct, really, because Barbara asked it. So I'm going, so thank you. So I'll perhaps phrase it slightly differently in that case, because it's a fascinating area of discussion. I'm really pleased that Councillor Patterson asked about the employer side of this strategy and how to approach those. You know, I was thinking on a very personal level that I have a niece in her 20s who is autistic. She has absence seizures. She's had an attempted suicide. She doesn't work. She doesn't think, and my sister, my family don't feel that she will have opportunities. She's now, I'm sure you've heard this before, but she's now reaching that crisis point, if you like. So I'm really, if they haven't already reached it, but I'm really encouraged to see that there's a strategy. It makes so much sense to me. You know, it's absolutely, you know, it's timely. It needs to be done, and I'm really pleased that this is going to reach out, perhaps in a kite mark way, if you like, to employers. So, I'll rephrase my original question slightly differently. Rather than how is this going to sort of reach other bodies and the public? How is this going to reach the people? How is it going to reach people like my niece, to give them confidence that things are changing, that there may be opportunities, that there is a strategy in place, that there's a different way of thinking, if you like? How is that message going to reach the people who need it?
I think part of this is the community offer. So there's a community engagement is a big thing. Okay, I think there's something here about normalizing the word autism. I think we need to really be mindful about some of the narratives that we're hearing about overdiagnosis. I think we need to be really mindful about this idea of what it means to be autistic. So a lot of it is about education. A lot of it for me is about presenting, and this would be one of the things that we'd like to be working on around when we're doing the launch, what an autistic person looks like. Yeah, because we know autistic people all look very different, and I'm a very different autistic person to somebody else. My experience of what it's like to be autistic has a massive difference from somebody else. So it's about that non-speaking. It's about different cultures, different races, different genders, different religions. So to get to your niece, we need to empower those around her to feel like they get her more, so then they can engage with her in a way that feels safe. Because obviously she is now in absolute crisis and burnout and has shut down. And we shut down when we feel unsafe. And that is what is happening to a lot of autistic people, is we end in this kind of autistic burnout because it is a lack of safety, felt safety, that comes from a place of not feeling like we matter or belong. And that's where I go back to this human rights issue. We need to realize that every single autistic person has a right to thrive, and they're not. And that's usually because your niece started in a place where she wasn't believed. Okay, her experience wasn't believed. We cannot change her past. And thank you for sharing the story. You know, it's incredibly emotive, but we cannot change what has happened to her. What we can do is take that information and hopefully prevent it happening in the future. And it will take time, but it is about building community. Your niece needs to meet other autistic people in a way that meets her needs. And she feels like she matters. And I think if we can get to mattering, we will then move on to belonging, and belonging then gives people that feeling of like, I can do something. So it's small, tiny shifts.
Can I just to say, open invite, if your niece wants to get involved in any of the working groups that we're running, if she wants to come and put her voice over and join us on some of the work that we're doing, that's a really healthy way for her to start to understand what we're looking at, why we're looking at it, to feel like she has a voice and that she matters. Absolutely. If she wants to come and get involved, please do.
It might be not her. It might just be because it might be too much for her, right? It might be that her parents or her somebody or yourself from that position, and then gradually we get closer and closer, and she feels safe enough to be able to engage herself. So it's just
love to work
getting people who know.
Yeah.
Thank you very much, Derek and Dee.
Thank you so much for that. And actually, I felt quite emotional listening to that response. So thank you for being so comprehensive. Thank you.
Thank you, Councillor Heritage. Councillor Gregory.
Thank you, and thank you so much for the presentation. My question has kind of been answered, but I just wanted to ask a little bit about what the website will, what information will be on there really. What will that be for employers or the wider community? Because obviously, if you're trying to reach everyone, it's making sure that it's something meaningful to the reader. And then also, how are we going to raise awareness of that information is there as well?
Some of it's just about word of mouth. We know word of mouth is incredibly powerful, and within a community like the autistic community, we know that it spreads. Okay, when something works for an autistic person, everybody knows about it. For me, the website is about being very targeted. So when you enter it, you will know where you belong. Yep, you will know where it is that you might fit in and where you might get the information. So there will be I'm a parent, I'm an autistic person, I'm a child, I'm an employer, I've no idea what I am. Could I be autistic? I'm an ally, I'm a healthcare professional. And within that, a lot of it will be kind of the same themes, but specific to the area that they're working in. But what we would then encourage people to do is go in and explore the autistic, I am autistic bit, to be able to understand how we might explain it to an autistic person, right? And for us, it's about bringing all the voices together. And again, this is a big piece of work, but I have seen it happen. I've got some ideas in my head, and I've got some examples that we will be kind of templates we'll be working off. I'm not just picking it out of kind of my own brain, although it's been there for a long time, to be honest with you. But I think there is something there about being really helpful for people when they're coming in, so they don't go in and go, whoa. Lots of websites feel completely overwhelming. So if you can go in and find your tribe within there, then you're much more likely to try and find out what somebody else's perspective might be like. So it goes back to that belonging thing, doesn't it? You enter it and you go, oh, yes, I belong there, I'm an employer. Or, oh, yes, I'm a child, I'm a parent.
Great, thank you.
Thank you, Dee. Karen's going to help us answer as well.
I'm going to hopefully summarise. So I'm really aware also of our time. So I think really good questions. Thank you for your comments as well. Communication, we have got a common strategy alongside this. I think it's too premature to actually answer, what the website will look like, and actually genuinely in terms of true co-production, as the working group finds its feet, if it's signed off today, that will be part of their role. And I don't think by no means any strategy we're going to launch it and everything's going to be great, because it won't be. And I think it's really important just to put some of those parameters around it. And I think it will be work in progress. We will learn as we go along. But essentially, having a website doesn't always, reach the people in the way that we want it to. And I think Dee's point about, word of mouth communities will be the success of this strategy. And I think around some of the points that we've made in relation to sort of communities and mapping out, actually that is one of the fundamental pieces of work that needs to be done, which will inform how we communicate moving forward. So whilst there is that, absolutely we will have a website and it will be informative and it will be accessible, that will be work in progress after this, aligned with the common strategy that we've got as part of our plan.
And just to be clear that the working group isn't just one group, it's going to be 6 groups. So there's going to be an overall working group, but there's going to be 6 groups one attached to each theme. And within that, there's going to be somebody will have experience co-chairing with someone from the service, and then obviously other members within that. So it's hopefully, fingers crossed, and it's about buy-in. I go back to risk. We need people to buy into this. And I kind of ask you all to help us really, really get people to buy into this, because if there is no buy-in, we are going nowhere.
Okay, thank you. So I think that's been a really good discussion, and quite right that we spent as much time as we have done on that. So I did have some questions that have been pretty much answered around the co-production side, which is I'm hearing that the Autism Strategy Working Group is where we're going to have the lived experience being brought into that space. And then I also have a question on, when we sign this off, Karen, this is coming to you to be owned by you by the looks of it, looking at the governance structure. Yeah. So my question is, this is going to be a huge piece of work, a huge field that you're going to be operating in. What support do you need from either the Health and Wellbeing Board or from Cabinet, given you've got 3 Cabinet members sat around the table, in order to make this successful?
Thank you. Really, really great question. So I think in terms of the governance and the oversight, I can absolutely categorically tell you that the working groups will keep us on our toes, quite rightly. We've got our own governance structure within adult social care and the wider council that it will feed up into the relevant places that it needs to go. One of the things I genuinely asked from, and I'd asked this from this group and cabinet members and all councillors actually, is when you're out on the streets talking about, talking to your constituents, talk about the autism strategy, talk about some of the work that we're doing, because whether we like it or not, a lot of, and I would say politically, a lot of your conversations in your inbox are probably driven by areas which sit outside of adult social care, may relate to highways, for example. And I think it's really important to, bring forward some of the really great work that we're doing and actually some of the support that there is. So I would challenge, and I think there is something within that in terms of which I think we need to take away, Bav and Derek, is about whether we just do an all councillor briefing to say this is a strategy, this is being launched, this is what we need from you. I think that would be a really good outcome from this meeting. Thank you.
Good, thank you. I'll take us to the recommendations, but before I do, I just get a temperature check from a request I'm about to make, which is I think that this should come back to us in a decent amount of time, so like a year or something. I think, I do not doubt the absolute intention behind this, but I'm hearing, very emphatically from Dee that now the work starts, and I'd be really interested in a very honest appraisal in like a year's time. Where is the intention and the delivery and how they sit next to each other. I'm seeing nodding head, so we're good with that one. So I'll read out the recommendations, which is we, the Health and Wellbeing Board, recommended to 1, endorse the Oxfordshire All-Age Autism Strategy 2026-2031, approve its publication and implementation, and agree the contents and principles set out in the strategy. 2, note that LGR, local government reorganisation, may affect delivery of the Oxfordshire All-Age Autism Strategy 2026-2031 by changing system-wide governance, leadership and funding arrangements. While this may cause delays, it also provides an opportunity to strengthen partnership working and improve service alignment. So are the board content with those recommendations? Great, thank you. That's all we need for that one. Okay, good. And thank you very much to the speakers. You're welcome to stick with us or enjoy the rest of the afternoon.
You say is it not fun?
Agenda item 7, the Marmot update. So this will be Kate and Jessica, I believe, that will be helping us through this. Who wants to kick things off?
Hi, thank you. Yes, I will kick things off. I'm Kate Holborn, Deputy Director of Public Health, and I've been leading on the Marmot Place approach in Oxfordshire. And Jessica, would you like to just introduce yourself before we start?
Thanks, Kate. I'm Jessica Allen, Deputy Director at UCL Institute of Health Equity, which is Michael Marmot's unit based at UCL. Thank you.
Thank you. And can you see the slides? Yes, you can. Okay. So I am going to briefly take us through an overview of where we're up to in Oxfordshire with Marmot, and then Jessica is going to do a far more in-depth presentation on the work that IHE have been doing on the deep dives. But one thing I'd just like to pick up with on the Marmot principles, based on that previous item on all-age autism, is this cuts across all of those principles. And if we think about how we're then going to take that forward, I think it's important that we are aligning two key strategies like this to make sure that when we start to look at things like Best Start in Life, we are also looking at that from something like an all-age autism angle. So I see great opportunities as we start to move to action plans on some of these deep dive areas. But what I want to tell you about first of all, is the developments that we've got going on in Oxfordshire beyond the deep dives. So one of the things that we have been really driving on is to try and build capacity amongst our professional network in Oxfordshire throughout the system and the anchor institutions. So first of all, you'll notice in the paper there was a quick reference guide that's now been introduced just to start to help people understand what we mean by health inequality and where they can go to use some tools for that. We also have a health equity network, which is hosted by the Institute of Health Equity, but very specifically for Oxfordshire. And it's a little bit like a LinkedIn version where people can share, the professionals can come and share practices and share stories and have conversations. And we also put things like webinars on there to help build the training. And then finally, we are developing health equity training that will start within OCC. And once we've managed to embed that there, then we're going to look to share that across the system. So all of that is to try and keep this social movement of embedding what an understanding of health equity is and inequalities resulting in poorer health outcomes beyond people who work in health services. So really thinking about the wider determinants. We chose to have three core Marmot principles that we would start with when we started this work in 2025, or right at the start of 2025. I'm not going to talk about the best start in life or the fair employment because Jessica's going to talk about that. But what I was going to do was just go through a few examples of how we've been progressing on the healthy standard of living. First of all, there is something called the Low Income Family Tracker that's been available for a while, and districts use this to help families get access to the benefits that they are entitled to. Some districts have been able to uptake this more than others, but there's been a movement recently to look at that, mapping through the Marmot principles, and Cherwell have worked on this and have therefore been able to identify more people by using those Marmot principles and generate greater uptake of benefits. So it's almost been a proof of concept, but that's very interesting to see what they've managed to achieve and an opportunity for us to take forward. I've been here before and talked about the fact that we've had a housing health needs assessment. One of the things that's come out of that is to work with the Housing Association Charitable Trust to start to build a partnership and a network for housing providers to work with other organisations within the system. So they've started by having conversations with different partners in the system and have then brought together people like, so in particular, the social housing providers, and then brought them together with people from local government and people from different parts of the NHS and voluntary sector to start to really build an understanding and trust of how we can help people in that particular housing tenure, and then be able to start to build shared priorities. So addressing that inequality of people who are struggling with maintaining consistent housing. Another key piece of work that we've led on in the last year is understanding the inequalities for people living in our rural areas. And I've talked previously about the fact that we'd identified 14 very small geographies where we're seeing really localised inequalities. And we've worked with Healthwatch and Community First Oxfordshire to go out and understand, actually engage with the local communities there, talk to them and understand their experience of living in a rural area. And some of the things that have come out of that have been, unsurprisingly, limited public transport, understanding the impact of new housing developments and those not keeping pace with services that are available, cost of living pressures, and things like food poverty and isolation. So the next steps for that are for us to look at that qualitative feedback that we're getting from our communities along with the data, and then develop a set of recommendations which we are planning to bring back to the Health and Wellbeing Board in September, if we're happy with that. We continue with the research agenda, and obviously we have an Oxfordshire research strategy, and the focus for the local policy lab has been around those three priority principles, and these are the local policy lab research projects ongoing at the moment and will be reported later on in July. And that's in collaboration between Oxfordshire County Council and the 2 universities in Oxfordshire. So moving forward, from the point of view of indicators, you'll be aware that we are reviewing the health and wellbeing strategy indicators and intend to absolutely align a health equity side to that, and that will be coming back to the board at a future time. We continue with our work with communities, and you know that ANSAF's Director of Public Health annual report was launched initially in March, and in fact we have a launch event tomorrow, and that's looking at the impact of those community insight profiles and using an asset-based community development approach in our more deprived communities. And I've also put the link there to the research that's been done on the impact of that and the Well Together programme. So we're going to continue to work with the neighbourhood health team and make sure that we're embedding health equity in that, work with the voluntary community and faith sector, and then of course, as was in the previous presentation, we need to think about the impact of local government reorganisation and what that does to our governance that we have at the moment, which is reporting to health and wellbeing, and also we have a steering and advisory group. So there's a few resources, and I'm going to pass to Jessica to talk about those 2 deep dives.
Thank you very much. Thanks, Kate. I presume, am I asking you to move forward? Thank you. So, as you know, because we've previously presented on some of the data for the focus on good start in life, give every child the best start in life, we now have a report, Starting Stronger, Fairer Futures in Oxfordshire, which is a summary of the insights that we have from the data, from discussions with lots and lots of stakeholders around some of the challenges that people experience, families experience, and also some of the enablers and things which are working really well. So this report summarises all the information that we've got, and we've had fantastic engagement, I will say, from lots of the partners across Oxfordshire, which has been really important, and it's given us loads of insights that we don't see in the data. So we have divided the report. We cover right from maternity, actually, newborns, through the early years and the extraordinarily wide gaps, as you're well aware, in early years development across Oxfordshire, but also thinking about the home environment, the capacity of parents to provide that strong home safe learning environment, into school-aged children, and again, the very wide inequalities in educational experiences and attainment, but also thinking about the environments and households that young people live in, the friendships, their opportunities for social life, and then into older school-aged children, into then employment and skills building. Cross-cutting across all of this is housing quality, access to good quality green space and opportunities for exercise and good mental health as a result of that. Community safety, it's really important. Young people always talk about, and there are big inequalities in this, inequalities in how safe they feel in public spaces, as well as at school and at home, and transport. And I'll just flag, we don't have it in the report, but a previous discussion I just caught the end of, and this thing about how much children feel they matter. And I think it's such a key thing, because we've seen from where there has been research, and there hasn't been much, but where there has been research on how much children feel that they matter to their family, to their immediate community and school, and to the world in general. And there are huge inequalities in how much children feel they matter. We haven't looked at this as in the previous discussion by autism, but we've looked at it by socioeconomic position, and children living in more deprived areas feel they matter less in all those dimensions. So I'm just flagging that because I think it's relevant. And then in this report, we also cover some of the blockers and enablers to really effective systems and delivery on this agenda across Oxfordshire. Thanks, Kate. So the way that we conceive of the change that we understand is needed is action on those Marmot principles. So in the case of this report, that's, as I've just described, from babies to young people, system change and culture shift. And that's around strengthening awareness about health inequalities and what drives those big health inequalities across Oxfordshire. How expert, capable people feel that they can make change in their organisations and in their roles to take action to reduce inequalities. And that's a really important point because people often are aware but feel disempowered or there's nothing they can do in their day jobs. So we tried to help build the capacity and awareness about what people can do in their day jobs. We talk about prioritising inequities in health and in all those other areas I've just outlined, which will impact on health. We've had great engagement across Oxfordshire from your extremely vibrant community, voluntary, faith, social enterprise sector. That's been a real positive. But again, they've identified, as I'm sure you're all aware, lots of barriers in terms of resources, competition between community voluntary sector organisation for the limited resources, some of the barriers between local government and community voluntary faith sector organisations, just not knowing what's going on, who's doing what. So there's a simple kind of coordination job that we know is needed in every place. And the strength of partnerships. So we've had good engagement from the universities. Kate outlined the research agenda, but also thinking about what those universities can do as vitally powerful and important assets and anchor organisations across Oxfordshire. Businesses, I'll come on to it, we've tried really hard to engage. They have an enormous impact on all of our health and inequalities in health and in all those social determinants of health. And we think there's always opportunity for them to do more to support health equity in very positive ways. And similarly, healthcare organisations, obviously mostly focused towards treatment, but we're always encouraging and really trying to get much more development around their anchor role and what they can do in the social determinants of health. And then these transformational processes, that's how we understand change in the sort of operationalising of this agenda in funding, in resource allocations, in the commissioning process, in accountability, social value, and that's how we can get this really embedded for the long term. Thanks, Kate.
Jessica, I'm just going to move us, move to the next slide, just saying if you could kind of do this in the next kind of up to 5 minutes, and then we'll have time for questions.
So this is the time now. Yeah, that's okay. I won't dwell on that, but we've got various activities to inform and try and get implementation and action. Next slide, please, Kate. We've had a very good advisory group throughout this whole process, and they've the last meeting we really pushed on implementation. What can they do as leaders in their sectors? And there were lots of good ideas about where we can embed this kind of work, the family hubs, neighbourhood health plans, post-16 education and business and employment, and there's more detail and we'll be pushing on that. Thanks, Kate. Some commitment, which is great, to reduce the inequality gap in good levels of development from 30 to 20%. We know that's been spoken about in this board, so it's been a really positive step forward. Thanks, Kate. And then moving into skills and employment, I'm just flagging up, we're now at the point of looking at the insights that we can get from data. This is apprenticeship starts and achievements. You can see that Oxfordshire is actually below the level of England in these apprenticeship starts, and then this huge drop-off in achievements, and around a third of young people who start on apprenticeships finish their apprenticeship. So there's a real cause for concern there, and plenty of opportunity across Oxfordshire to improve that. Thanks, Kate. And differences between the districts. Thank you. Percentage of those with health conditions, you can see again there's differences between the districts, so we really want to encourage an increase in people who have health conditions for long-term health conditions to be able to participate in the workforce and carry on in employment. And again, you can see Vale of Whitehorse below the England average here. Slide, please. This is some new data that we're just putting together about the gender pay gap. It's big, and you can see in the southeast of England, the bright green bar is really high among associate professional occupations. So about 25% gender pay gap. So that's people at equivalent levels according to this occupational hierarchy, the gap, and that's around £200 a week for associate professional occupation. So some really big gender pay gaps. That's across the country. But some insights for the South East region. Thank you. And what to do about all of this? We had a really good business roundtable discovery session with some key businesses in Oxfordshire who had lots of ideas, really keen to engage. That was very encouraging, and particularly focusing on encouraging young people to have aspiration to work in the businesses across Oxfordshire, recognising that needs to start at a much earlier stage, probably in primary school. Go in, build the aspiration, show them what a day at work might look like, and not just leave it to the age 16 where many are already disengaged or feeling anxious, hopeless, and so start early, and they're very keen to involve themselves in that agenda. Next slide, please, Kate. So we're going to be carrying on this theme around good employment, building skills, and so on. Obviously, there's a national movement behind this now, and lots already happening in Oxfordshire. Some really strong work, which will hook into it. I think the added value that we will bring, I hope, is around that health equity case. This is absolutely key to good health and health inequalities across Oxfordshire in the immediate term, in terms of mental health, but longer term as well. So good quality employment is absolute bedrock for good health. Thank you. So we'll be bringing, I'm sure, some of these outcomes from the next phase of the work to you at a later date. Thanks, Kate.
Thanks very much, Jessica. And if I could just close by saying that of those 2 deep dive pieces of work, the Best Start in Life report that Jessica showed us, that will be launched today. And you'll see the link within the paper that is within the pack. And the fair employment work is now, we've started with that roundtable, business roundtable, and we're moving on now to work with local businesses and partners and think about what we can do about particular focus areas. So happy to take questions. Thank you.
Thank you very much, both. I've got some questions, but I'll hold out. We'll see which members want to come in first. So, Councillor Gregory.
Thank you. I've actually got a lot of questions, so I'll come back if my questions don't get asked, because I don't want to hog the microphone. My first question is around the districts. You mentioned that obviously one of the districts was much more engaged when it came to using the lift information. Is that which obviously that provides an inequity in itself, because there's some areas of the county that aren't receiving that kind of granular support. What is there anything we can do to try and engage the other districts in a way that's more equitable? Thank you.
Thank you. So with the lift tracker, that's available to all of the districts, and I think they all use it to a point. Yeah, they do all use it. It's that Cherwell were looking at it almost as a trial to think, if we looked at those Marmot principles, would that bring us any more? And they did find that actually having a bit of a focus for how you would use it then gave them a bit more insight to it. So what we do now is we share the learning from that and see if we can then help other districts to take the approach that they took. So it's absolutely not meant to be driving further inequity. But with trials like that, you almost need to start somewhere.
Would you mind if I just comment on that? Because I know that South Oxfordshire District Council, and there might be other councils who wish to comment, but we're utilising that platform very well, I believe, at the moment, and we're using it as a way of getting in touch with people who might normally need certain support packages and financial assistance. And we're using the Lift platform to go to them before they need to come to us. Yeah. So it is being utilised in a very positive way, I think, across the districts. But certainly, I think bringing it into a Marmot sense would would equally be beneficial to us.
Did you have any more questions, Councillor Gregory? Okay, so Councillor Fletcher next. Apologies, I have to call you Councillor Fletcher. And then I've got Councillor Thomas and then Councillor Coleman. So Councillor Fletcher, please.
Thank you. It is Becca. So I have a few questions. On the lift data, is that, in terms of the data that we have, how much of the data that we need about people is included in the lift data, and do people have to agree for us to have that data? I'm just wondering I'm wondering how limited the data are, and whether there is more that we could get that would then help us to be able to signpost people in the right direction for things that are available to them.
Okay, that's quite a technical question about lift, and I think I will take that away and come back to you, because I think I can't do justice to that question. Thank you.
Okay, thank you. And then, sorry, I'm just going to move on. I'm not even going to ask. And then another slightly less technical question. You talked about there being 14 areas that we've identified. I think previously I've seen mention of 10. Do we have that list of 14 somewhere?
Yes. Are we talking about the rural inequalities? Yes, I can provide you with that list. Yes, absolutely.
Just on that, I think we're referring to the lower super output areas, aren't we? So the 10 wards, the 10, the rural list. Okay.
So Councillor Thomas, please.
Thank you. Thank you, Jessica. Really interesting, and apologies, I missed the first bit. I was struggling to get back. Yeah, I noticed in one of your later slides there was a significant drop in bail figures for, I think it was long-term unemployed or training NEET for young people. I was wondering, and it can be taken offline, but I was just wondering if you could unpack that at all, and whether there would be any targeted focus on that area. It was.
I'm not sure which slide you referred to. Was it
you
the
particularly noted it was Vale of Whitehorse was under the English average.
Yeah, okay, so that was percent of those with health conditions lasting more than 12 months who are in work. Yeah. So the point of looking at districts is because we have the data available at districts, and it gives us an insight into the fact that, you know, some districts are really falling behind on this. So this is a really important indicator, and there's definitely things that can be done about this. So it gives us an area-based focus. A lot of this, of course, is to do with levels of deprivation and the kinds of employment people have available to them, which may or may not be, they may not be able to engage with. But it's just, I guess, an indication that there's something going on that needs further investigation. If that makes.
I think Ansaf is also going to help us with the answer.
No.
Ansaf is going to sum up, is what he's going to do. Okay, Councillor Thomas, is that an answer to your question?
Yes, that'd be fine. Thank you. Thank you very much.
Councillor Coleman.
Yes, I was just interested to see how our apprenticeship data was quite poor, with people not finishing their apprenticeships. And I've noticed, living in our rural area, that it's quite difficult for young people to actually travel to an apprenticeship. It's quite easy to travel to school to do your A-levels, but if you're on a vocational route, it's much harder to get to college, and even harder again to get to an apprenticeship setting. Have we done any analysis into whether it is a transport issue or whether there's other factors involved?
So we haven't. I'm just going to flag there that I was in Birmingham last week and we had the same data, and they have the same big drop off in apprenticeship starts. And I think there's something about the apprenticeship scheme which is generally quite inappropriate. I mean, that a lot of young people are dropping out. So, which is obviously really bad for the businesses who are running the apprenticeship, and terrible for the young people who have this, you know, feeling of failure and so on. So I don't know the answer to the questions why it is, but I would imagine it's not just, given that Birmingham's the same, and Birmingham obviously different transport issues. I don't suppose it's all down to transport,
No, okay.
but it probably is a factor. I'm sure it's a factor in Oxfordshire because, as we've heard many times, transport is always an issue in Oxfordshire, isn't it, in terms of the inequalities in access to almost all services.
Yeah, I mean, I know young people from affluent families who manage to travel from Chipping Norton to Culham to do an apprenticeship,
Right.
whereas people from other families just wouldn't even apply because it would be completely unachievable.
Yeah.
I'm going to need to turn into a strict chair at some point. So can I bring in Michelle and then perhaps Councillor Thomas, I'm guessing, as part of this Q&A. So Michelle, please.
No, thanks, Jessica and Kate. I just wondered, how are we looking at a golden thread through all of these reports? Because the Vale of the White Horse is being flagged as an area consistently for underdevelopment of children. We're not seeing the big fall off because of long-term conditions in apprenticeships. I just wondered, there seems to be a consistent thread about the Vale of the White Horse, and we all know that there's been a massive increase in housing development there. And I just wondered if we are going to look across, we're doing all these reports, but whether, there are some themes, and actually, if you have poor development as a child and don't reach your milestones, then you're going to struggle as a young person, lack of confidence in what matters to you to get your apprenticeship or stay in that apprenticeship. So, there seems to be a cycle there, and it would be a real loss if we don't do a horizontal analysis as well as a vertical.
Yeah. Okay, so my proposed approach and answer in this is Councillor Thomas has got a hand up, who also happens to be the leader of the Vale of White Horse District Council. So that could be quite helpful to hear from Councillor Thomas. And then I've got a question or two myself, and then look to Ansaf to help us sum up. So Councillor Thomas, please.
Yeah, thank you very much. I did want to echo those comments just before. I mean, obviously, I highlighted the point I raised, but if there is sort of a continued pattern right throughout, it would be wonderful. And I did say, is there going to be a targeted approach to Vale if this is a trend? And also echoing Councillor Coleman's point about transport. I've heard that so many times about transport in both West Oxfordshire and Vale, and I'm sure other areas, but it is an issue when it comes to apprenticeships. I've spoken to employers as well. So yeah, there's a lot going on there. Thank you.
Okay, so unless there's any other burning member questions, as we move forward into future health and wellbeing boards, where I'll be trying to shape this into is I love the data and I love the analysis and I like the findings. What I'm really interested in is the what next and what are the actions and what are the results that were happening. What I think would be really good is if we as a health and wellbeing board can articulate back to the residents of Oxfordshire that we have identified issues and this is what we've done about it and this is who's been affected in this order of magnitude. So that'll be the thing that I'll be trying to shape in future agenda items. But did you want to come in at that point, Kate?
Yes, absolutely, because we recognise that the report that's going to be launched today is it has a set of recommendations, and now it's really important that we as a system work on those to think what are the actions out of these. We've already had one workshop, we've got another workshop next week to start to take those recommendations and think where are they going to sit, where are they going to report to, and what are the specific actions we're going to focus on. So we are taking that next step to convert this into actual change.
Ansaf, do you want to help us sum up and then I'll go through recommendations?
Yeah, sure. So I think before I kind of sum up, I just want to clarify this point around, I think really good points have been made about sort of looking at things vertically as well as horizontally, because we obviously focusing on those three themes, early years, employment and good standard of living. And there will be reports coming out like this that will give us detailed information about it, and that will create a work stream. We do have the moment steering group, which we have got all the partners are engaged in that. So that will be the kind of engine room that will pick up the actions and what we need to do on the back of that, this report. And then that will then feed into the Health and Wellbeing Board, where we can scrutinize that and go further with those things. So just to be clear, we are doing that kind of vertical pieces. At some point, I think, like you said, Michelle, we do need to look at things across horizontally as well, because if you look at best start in life, and if you look at employment, poor employment opportunities will impact on best start in life, and so on and so forth. So there will be emerging themes that we have to pick up that will cover across all of the principles. And it may well be that there are 2 or 3 things that we want to tackle. But I think we need to give the space and time for the vertical reports to be detailed. That's the first thing. The second thing is that one of the things that I've actually outlined on the back of the Director of Public Health Annual Report release is that we are going to do a community insight profile for all the communities in Oxfordshire. We are now starting to go beyond the 10 wards that we traditionally talked about. We're going to, it will take time, but eventually that approach of gathering the data at a community level, speaking to the community insights, getting the insights, and then mapping the assets and coming up with some recommendations. So places like Didcot might be particularly areas that we might want to look at, which are probably quite fast growing. So we will, parallel to the conversation we just had now, we will also be doing that community side profile. But the key thing that I just want to highlight is that I think in addition to the work stream that we just discussed here, I think this is also a bit of a social movement. And it's really, really important that each of you in all of your areas look at how can we actually make an impact on reducing inequality in your own area, in your own areas of work. Because I think while we do these kind of vertical lines of work and thematic works, I think there's a real danger that it becomes, oh, this is a silo piece of work that sits with the Marmot steering group, and that's it. I think everyone, in addition to those Marmot steering group work, I think everyone should start to think about, and I think that's my ask for the Health and Wellbeing Board members, in your own portfolio areas, think about how can you actually reduce the gap on inequalities. And I think it's absolutely right, we need to do both. One last thing I want to mention is LGR. We're going to obviously know the outcome next week around LGR. I think it's really important. I think it's making a really positive change. We've seen our IMD data has improved in Oxfordshire. Our deprivations have come down. I think we will, if public sector reform and LGR means that we lose the momentum on this, we can undo some of that. So we also need to focus on how do we protect and retain this and expand this post LGR outcome, whatever that may be. Thank you.
Yeah, completely agreed. I think all of us have got an ambition, regardless of the LGR outcome, it's 1, 2 or 3. You know, we want the new authorities or authority to be set up as strong as possible for Oxfordshire to be in the best possible place, and that be our handover. So unless there's any other member questions, the recommendations are 1, to note the progress made in embedding the Marmot approach using the 8 Marmot principles as a framework for understanding inequalities and strengthening system-wide action on health inequalities in Oxfordshire. 2, to note the next phase of delivery focused on converting insight and deep dive recommendations into agreed actions, clear ownership, and measurable outcomes. I mean, frankly, number 2 is absolutely perfect and needs to be the focus. And then 3, agree that Marmot-related equity measures should be embedded within the refreshed health and wellbeing strategy outcomes framework to strengthen oversight and accountability. Is the board in agreement? Thank you. So that takes us to agenda item 8, the neighbourhood health plan updates, which is at a bit of a complicated bit of its journey because it's also coming to HOSC later in the year, as I was speaking about earlier. So at this stage, we're just sort of noting the progress, but actually what's really important is we get it after HOSC have done their work and had a real good, nose around and poke and a prod, etc. And then they can give us, their considered view and recommendations if that is the case. But otherwise, I'm guessing I'm handing over to you, Michelle.
Yeah, no, thank you. So since we were last at the board, the National Neighbourhood Programme team, led by Professor Claire Fuller, had visited Thames Valley ICB, and there was a meeting on the 23rd of June, which Ansaf, Caroline and Grant MacDonald and myself attended along with other colleagues from across the ICB and health and care sector. I have to say it was quite NHS focused, but I will proceed. what I think we got really praised for was the work we've done on developing the geographies. It noted that we've got the 15 geographies. They've been approved for this year by the Health and Wellbeing Board. We've moving forward now. We have started to look, if you have a look at the neighbourhood framework, there is a system architecture that we're also moving towards, which is single neighbourhood providers, multi-neighbourhood providers, and then an integrated health organisation. The multi-neighbourhood providers are likely to be at a 250 population. So to sort of just start that work, and we are trying to be very mindful of local government reform as we progress. And again, we were commended for that by the NHS England, because lots of places that they'd visited hadn't even had the geography signed off. So we are starting to work more at scale in North City and South, and that, depending, irrespective of what the outcome is for LGR, that gives us approximately the 250 areas for the multi-neighbourhood providers, but still having the much smaller neighbourhood footprints that we are starting to work on. Asaf gave a very good presentation, and again, I think you gave a really good presentation on health inequalities, which was very different from many other areas and was noted in Claire Fuller's roundup as, a really, that is the ambition for neighbourhood health. We can't just focus on health, we've got to look at the wider determinants, and sometimes I think we become very health focused, although that's important. I think if the NHS is to survive, we need to look at the wider determinants and have a really strong focus on the 80%, so that we prevent people needing the NHS and those that can look after themselves and use other services do. So I think that the meeting, went very well. Also, there was a real drive. Currently, we've got the INTs that Lily O'Connor has developed, but there was a quite difficult questions about what are you paying for? What is that funding buying you? So, and it wasn't just Oxfordshire, Buckinghamshire, and really sort of saying, how many GP sessions are you paying for? Consultant versus GP doing things. So there was quite pointed questions and asking us to go away and reflect on actually what we are funding and what we're getting for that funding. Other areas that came up in the meeting, I think, was as we moved to IHO, so independent health organisations, looking at how those boards become accountable and report, because overall the Health and Wellbeing Board in all the documentation still holds the accountability on neighbourhood development. As some of you may recall, the ICB had something called the Innovation Fund, where 17.3 million was designated for neighbourhood development, and some of that has come to Oxfordshire to develop frailty and children and young people NDTs. So we have just looking at the data around that for each of the neighbourhoods, starting with frailty, and then we will move on to work with OUH colleagues to look at the children and young people NDTs. And the way the children and young people's multidisciplinary team data has developed is they've looked at the top 3% of children and young people across the whole of the Thames Valley who are having the most touch points with health, so community, mental health, general practice and secondary care. And then the idea is that general practice, mental health and consultant paediatricians will work together to try and develop care plans for these young people, and to prevent them having so many different touch points, and they have better continuity of care. So that's a model that's been developed in Northwest London. The ICB has offered a small amount of funding to try and roll that out across the whole of the Thames Valley. And as I say, we're just starting to look at frailty and how we implement that within each of the neighbourhoods, because they're all at slightly different levels, because some of the neighbourhoods already have some integrated neighbourhood teams, whereas others are, you know, starting from the beginning of that journey. Welcome, Chris. Great timing. And Ansa, Grant, I don't know whether you had anything else to add.
Yeah, so just very quickly to mention that I think we came across an area out of the three that actually has got very strong local government involvement. So it was great, and I think the fact that we have made some improvement in our deprivation, albeit the gap is still quite big, was quite positively received. I still do think we have got an opportunity to still really harness the power of neighborhood health in tackling some of the wider determinants of health, and I feel like once we have those integrator posts in the three areas, that would be a really good place, because we just talked about some of the market ambition, and there are lots of themes that are coming through. The trick with all this is to not necessarily create separate silos pieces of work, because there's only so much capacity that's available. The trick is to align it with key areas of work, and neighborhood health being one of those key programs of work means that we do need to get better at aligning the work around wider determinant of health with the neighborhood health agenda. Having said that, I think it's great that the progress that we've made. There's a clear NHS criteria to deliver against, and I think we are making really good progress. But we do have that opportunity to build in the prevention and the wider determinant of health furthermore as we kind of develop those integration models. But overall, I felt like we had a really good partnership working arrangement at Oxfordshire Place.
Just before I bring Grant in, you will recall also we got the neighbourhood got allocated some funding from the Better Care Fund, which we're proposing to put towards getting a neighbourhood integrator director, some integrator roles in each of North City and South, and also some clinical leadership to really sort of try and drive the development in each of the neighbourhoods.
Did Grant want to come in?
Yeah, I've not got much to add, Chair, really. I think picking up on those points, I think one of the key things that we're moving towards now is making sure that we do have the resources to make this work instead of it be a lot of good words. So we need infrastructure, and we need to not have new resources if they're not required, but where they are, to coordinate the work across Oxfordshire and make sure that we can push the ideas forward instead of just having the ideas. So I'm quite hopeful we've agreed a skeleton for those resources that's quite able to resource within budget and not affect direct social and healthcare services. So I'm quite hopeful, Chair, that we can turn some of the rhetoric into sort of real work over the next year or two, building on the good work that's been done in Oxfordshire and social and healthcare already.
Thank you. Are there any other speakers on this before we bring in members?
Just wondered if Chris wanted to say anything. Sorry, Chris.
Very well timed, Chris.
Yeah, wasn't it just? Apologies for lateness. So I'm Chris Wright, Associate Director of Place for Oxfordshire, work for the Integrated Care Board. I presume colleagues have covered off key points. I guess just wanted to add a minor bit of detail around the resource in order to deliver, and Michelle rightly pointed out some of the integration posts as well, but we've also been working really closely with several colleagues within Health Watch and voluntary and community sector to also identify how we might be able to resource that sector in a more meaningful way to engage with this agenda. And from a process perspective, we will be developing and submitting an action plan back to NHS England to translate some of the reflections from the visit into a kind of a single programme of work. Part of that as well will also involve appointing a kind of strategic development partner to provide some additional capacity for this. I think that the day itself was really useful in some thought-provoking questions, some of which we had considered, but others around specifically for kind of commissioning arrangements from a provider perspective, were things that we hadn't really grappled with to date. So yeah, only additional points for me.
Thank you. Michelle, was there anything to finish on? No? Okay, member questions? No? HOSC, their chair, Councillor Hannah, was speaking to me prior to today's discussion. Clearly, we're looking forward to them receiving this work and them having the space, be able to give it a good level of scrutiny, and we eagerly await any recommendations that might come from that, and then it passed through to us as a real considered piece of work. It was the geographies piece that Councillor Hannah raised with me, and the nervousness is that there's a risk that it might go to them in November with the geographies already settled and baked in. And can I just try and understand where we are with that, because you've mentioned today that 15 geographies have already been approved by us?
Yes, so the 15 geographies were approved by the Health and Wellbeing Board, but they were just for this year. So we just needed to have some geographies to get started with. And so we've got the 15, but it's really now we're starting to move down into geography levels and seeing what works and what doesn't work, and obviously use that learning then to inform how we move forward next year.
Thank you. That's a really helpful answer. So I guess that we're all motivated by, achieving a plan, that has, full-throated consent and sign off and willing sign off from, all these various boards and scrutiny. So it sounds like, we're very much on track and heading in that direction. Is there anything anybody else wants to raise before I take us to the recommendations? No, in which case then we are being asked to note the neighbourhood health plan. So this board agreed. Good. This is the bit I've been looking forward to. Agenda item 9, prevention of homelessness directors group update. And we've got Richard and Grace. We're going to come and join us and talk us through their good work. I'll hand over to you both. Thank you.
Oh, there we are. Oh, thank you very much. So Caroline Green normally leads on this item. She's unable to make it today, so Richard and I will be just providing an update. So I'm Grace Hine, I'm the Oxfordshire County-wide Homelessness Partnership Manager. Richard, if you want to go next.
Yeah, I'm Richard Smith. I'm the head of housing at Cherwell.
Some background on this item. So we relaunched the Prevention of Homelessness Directors Group early 2025, and as part of that agreement, we said that we would come to the Health and Wellbeing Board every 6 months to provide an update on various work streams and priority areas. The last time we were here was around December, and we'll give an update over the next few minutes just on a number of different work streams that have been progressed since then. So one of the big key pieces of work over the last few months has been the refreshed homelessness and rough sleeping strategy for Oxfordshire. We are currently in a 5-year strategy which comes to an end this year, and we took that strategy to Prevention of Homelessness Directors Group in October of last year and asked for advice on what they would like us to do, whether we went for an extension, a refreshed version of it, or just let it come to a natural end. We were advised to refresh the strategy, given that we are in a very different landscape than we were in 2021 when we had the Everyone In scheme going. We were in the middle of COVID. We're in a very different place now. So we took that away. We worked on it over a couple of months, sent it to redrafted version of it to partners at the start of the year. And then as part of that process, realised that we had made enough substantial changes that we probably needed to go to public consultation to give those with lived experience and some of our commission providers and other agencies an opportunity to feedback on that. So that consultation was launched in March and ran for 10 weeks. We received 136 responses to that. I think it was about 24 of those were lived experiences, and then others were residents, other organisations, that sort of thing. Just some key highlights from that consultation, so I'm going to have to read these, I don't remember the statistics off the top of my head. More than 90% of the respondents supported strengthening early intervention and prevention. One of our key priorities as part of that strategy is prevention first, so that was a very positive response. 79% supported a greater emphasis on a housing-led approach. That is both locally and nationally what we are moving towards. So where the accommodation and the support are separate for those individuals. And then 93% agreed that a stronger joint working between housing, health and social care services was needed. So again, that's very much in line with what we are doing and progressing within PHDG. So in terms of next steps, we are currently updating the strategy to reflect the feedback received through the consultation process. It will then go to each partner, so that is the districts, the city, the county and Thames Valley ICB for their feedback. And then it will go through everyone's respective governance channels for sign off. So for example, in City, that will be going to Cabinet in September. Alongside this, we are developing an action plan. So while the strategy kind of sets out our shared vision and priorities, the action plan will focus on the kind of practical delivery of those commitments and kind of identifying what the deliverables are, the responsibilities and kind of those milestones. So subject to approval, we expect that the refreshed strategy and action plan to be implemented later this year. And I'll pass over to Richard for the rest of the updates.
Yeah, thanks, Grace. So to focus on some more of the strategy has been a key part, as Grace says, over the last few months. But some of the other actions that the group and the wider system have been undertaking. There was a number of housing summits where we got a lot of partners from health, social care, voluntary sector agencies together to sort of talk about what we felt the blockers were in the system, how we could improve. And one of those key outcomes was the work with registered providers. See, Oxford City is the biggest registered provider in this area, but then obviously all the districts have got de minimis stock holdings, so rely on Cotsway, Sanctuary, Sohar, those sorts of registered providers to provide the social housing, and therefore, you know, obviously with it, we're talking about homelessness here, housing is obviously a key part of that. So you know, strengthen the coordination between them. So we have an RP forum that's been set up. We've had 2 meetings. That's chaired by Sohar. They obviously, as a RP, chair their forum, but obviously the districts and the city are obviously supporting that and helping set that agenda. So at the last meeting, we have some very useful and interesting conversations around temporary accommodation and how we can work better in partnership, because that's a growing demand, and you know, across the system really the numbers of how temporary accommodation has increased across the county over the last couple of years are obviously a significant challenge for budgets and those people also living in those that sort of accommodation, which often is you know, not as good as it would be if it was someone's permanent home that had been properly assessed for them. And then another area of work alongside the RP forum has been the strengthening of work of sort of the partnership work and the engagement between the housing teams and adult social care, with a view to the better, you know, a lot of the individuals that are within the system that we're dealing with here will and are known to multiple agencies, and therefore it's the coordination of that response you know, is important to those individuals with complex needs. Similarly, the co-commission is a piece of co-commissioning work that, you know, with health services, because sort of Grace mentioned about the housing-led approach, which, you know, is about getting the person in the right accommodation pathway at the right time, depending on their needs. Obviously, what a barrier, you know, to that can be is availability of accommodation in other pathways, and therefore sort of blocking, I suppose, if for want of a better word. So you've got people who might not be in the right place considering what their current support needs are. So looking at if the options that are out there in supported accommodation are the best, considering the rise in single homelessness, particularly, that we're all seeing over the last, say, 2-3 years, the single homelessness numbers and those that are in, not necessarily those that are rough sleeping, but those that are in sort of temporary accommodation, particularly, have significantly increased. There's an ongoing piece of work as well, just sort of finally, with the Adult Homeless Pathway, or the Alliance, which is the 6 providers that obviously we've talked about at previous meetings, that are providing the sort of non-statutory services to homeless people and those at risk of rough sleeping. That similarly was set up in sort of 2021, 2022, and the realisation that time moves on, and where the things that were commissioned at that point need to make sure that they're still meeting the needs of the populace. So the prevention, move on panel and housing led support transformational changes that have come out of that review have started to be mobilised, and then the changes to the way that the outreach service runs across the city and county is progressing, but is not yet come to fruition. But hopefully that will happen before we come to this meeting next time.
Thank you. So I have some questions, but I'll throw it out to members first. No? Oh, Rob, Councillor Patterson, sorry.
Thanks, Chair. Rob's fine.
Be formal in this.
Oh, sure, yeah.
And then in the pub, I can grab
yes, yeah, fair enough. Thanks both. Really interesting report. I've just sort of, maybe a slightly technical question just in terms of my understanding, but really positive that the levels of rough sleeping have stabilised. I was wondering if we know that is because there's a genuine sort of reduction in homelessness, or is it because we're just managing people better in temporary accommodation? So it just keeps the level. It's sort of a bit of an illusion almost. So yeah, just a bit of insight on that.
So in terms of rough sleeping in Oxfordshire, we have been quite stable compared to what we've seen nationally, which is that rough sleeping is not as stable as it is here. So they are generally increasing. I don't know if you want to add anything to that, but yeah, we are kind of against the trend with that, which is a real positive. But that's, I mean, we always kind of caveat that we're saying, yes, it's a positive that our numbers are stable, but we still have too many people living on the streets. So that's why it remains a priority for us.
Yeah, just to come in on that, Councillor Patton, I think what I would say is that even though we homelessness is quite a negative subject, and we often talk about problems to solve. Country, I think there's only 3, and Oxfordshire is one of them. And so the services that are provided to people that are on the street by organisations like St Mungo's. St Mungo's are the country leading organisation in rough sleeper support, and obviously they're operating in this area. So I do think that there is something to be said for the work that the Adult Homeless Pathway as a collective are doing in this area is providing a good service to help move those residents on from rough sleeping, because that's something that I've not got the stats in front of me, but there are some positives, particularly obviously I'm focused on Sherwell. Our rate in moving people on from rough sleeping within 12 weeks is really quite good. So unfortunately they're replaced by other people, which is part of the ongoing challenge. But yeah, I do think that there is, as Grace says, there is a bit of we are against sort of some national trends here, particularly, it's not the cheapest place to live in Oxford and Oxfordshire. So, getting a private rent for somebody, there's a lot of competition out there. So, yeah, there is a lot of good work going on despite challenges.
Sorry, just a little follow-up on that as well is, so we are developing some key performance indicators for the Prevention of Homelessness Directors Group, and that is both how we approach homelessness county-wide, but specifically linked really to the new strategy over the next 2 years. So we are looking at what our rough sleeping target would be. So like the city already has a target, and then we're developing with districts what their targets would be as well. And we are trying to be realistic but also ambitious, and bearing in mind that rough sleeping numbers do fluctuate throughout the year according to the weather. So yeah.
I've got Councillor Fletcher and then Barbara.
Becca's fine, thanks. I have a couple of questions. So firstly, we talked about kind of prevention and kind of targeting people at risk. what kind of work are we doing with at-risk groups? So I'm thinking in particular of, say, like veterans or LGBTQ plus sort of children or young adults who are potentially don't have support from their family. Are we targeting groups that historically or statistically are more likely to end up rough sleeping, as well as targeting individuals? That's question one.
I think what I'd sort of come back on that to say is that a lot of the services within what the paper covers are to those that are unlikely to be hit the priority need or the priority thresholds from the districts through statutory services. The groups that you're talking about, veterans, for instance, through the Armed Forces Covenant, all everyone, it's within legislation that councils have to prioritise them. So the people that are, generally that are within this report are sort of those ones that are falling through those statutory thresholds. If there is an issue with veterans or sleeping, as an example, then that needs to, the role of of St Mungo's or connections would be to engage that person into statutory services, because the statutory services should be providing support for those people as a priority group.
Okay, great, and thank you. I think probably falling through those, I'm just thinking about my own division, I think there are a number of cases where that they have fallen through the cracks, but I will take that up. Thank you. I'll take that up offline. And then the other thing is talking about moving people on more quickly. Just is the barrier to that solely an availability of more permanent housing? Is there a barrier? I'm just thinking about, in People Committee, we looked at domestic violence supported accommodation, and one of the key problems there with kind of facilitating people moving on is a reluctance to do so, right? Because you want to stay where you feel safe, and that transition is quite a difficult thing to manage. When we're talking here about moving on, just because I hated the idea of moving someone on again when they've been homeless for a number of years, it just feels awful. But when you talk about it, are you talking specifically about enabling people to move from a temporary place to a permanent place, or are you talking about other things when you say move on?
Okay, so just to pick up on the move on, generally that means from a supported accommodation pathway. So domestic abuse is, like a refuge, would be a supported pathway, but that would be through a different, that domestic abuse is under the sort of a different governance here. So this would be, say, the mental health pathways, or the accommodation that's provided for those sorts of needs. So it's where that individual, we feel that they could then move on into a pathway with less support or into general housing and free up that bed, for want of a better word, for somebody else. That's the blocker. But in terms of your overall question, there is obviously a piece here about if there was more housing, there would be less pressure on services. I don't think that will come as a surprise to anybody, but there is no sort of silver bullet here. There is a lot of vulnerable people now, more and more vulnerable people that are in this system, that I think giving them a general housing tenancy with no support is likely to lead to repeat homelessness quite quickly. And that's why there is, more moves around the housing-led, housing first accommodation, where, the support is provided with you, it's to keep you in that property. So those sorts of approaches are, that's where the sort of change and flux in the pathway is coming in, because yes, we do need, there's a growing number of people that need the 24/7 support accommodation. Moor Court in Banbury as an example, and Matilda House in the city, and various others. But there is also that, to go from 24/7 support, the move on for that person is not necessarily a general housing tenant with zero support, or somebody just making sure you're paying your rent or something. I mean, there's a bit. So it's making sure that there are those sort of, there's a ladder, I suppose, of want of a better word, to create mobility within the pathways.
And I think what's really for people who aren't really as aware of like housing first or housing led type accommodation, what's really important is if they don't engage in that service or that support, their housing isn't jeopardized. So that's what's really good about that model and why it's been so successful worldwide and why we're pushing it within the UK. So yeah, just so that just to reassure people that it's not just a case of when people then feel safe in their accommodation, if they then don't engage in support, they don't get moved on somewhere else.
Sorry, I just want to follow up on that.
Someone wants to answer.
So I think it's really important to, I suppose, distinguish between, I suppose, what our roles and responsibilities are. And actually, with this transition period, and there are other pathways. So if you look at the mental health pathway, there are transitions where people will move in and they will be given the support to be able for them to lead sort of independent lives without, the totality of that really intensive support. And that is a really, really important pathway, because a lot of these individuals have lived without support, or they don't know what they need to do. So again, that's really important to distinguish. And as part of our process, and I think there is something across the homelessness directors group and some of the work we're doing in the homeless area about how we link that to some of the other work we're doing across the system, whether that's in mental health, for example, which is something that we're looking at connecting the dots. But there is an absolutely valid place for some of this transition housing, because actually that plays an important part of reintegrating people back into the community with the support they need.
Yeah, thank you. I appreciate that these are all different pathways. It's not an understanding issue. I'm just saying that, so in this paper particularly, when we are talking about establishing, so I'm on page 221, establishing a clear system-wide move-on proposition, and then rebalancing provision and then improving flow. When we are talking about that, are we talking about an availability issue, or are we talking about a reluctance issue, or are we talking about housing or the support? Or is it all of them? Because it's a little unclear to me from the paper itself.
I would think it's quite difficult without talking about individual examples and talking about those pathways, but I would think it's all of them, but it is mostly about the availability of, so ensuring a person who there is something available for someone to move on to, whether that be another pathway or a general housing property altogether. Because if, for instance, if you are within a supported accommodation pathway, you aren't homeless. So the district, the local authority, the local housing authority would prioritise homeless people above those that have got homes, generally speaking. So it's making sure that those people can move on and aren't sort of sat for 2 years and waiting for something, and then also making sure that there is that sort of partnership work, and that because a lot of us, like the city slightly differently, but the districts are all working with registered providers and nominating these individuals to those properties, and the individual registered provider will have concerns about taking a very vulnerable person into accommodation where they've been for the support. So it's all of that sort of work to make sure that person can succeed.
That's what I wanted. Thank you.
Thank you. Barbara.
So it's important to see the focus on prevention of homelessness, and people who are at risk of homelessness is often due to a number of multiple different factors. Could be loss of employment, could be debt, which is increasing now through the cost of living crisis, ill health, caring responsibilities, relationship breakdown, to name a few. So how is the strategy promoting a holistic approach that addresses all of the factors that are leading to the risk of homelessness? And how are you working with the voluntary sector in order to provide that support?
Yeah, so one of the big focuses, so I think it's priority 4 or priority 5, is around stronger partnerships. So it is about working with those agencies or those organisations that we haven't necessarily been as engaged with before, to be able to identify those people at risk of homelessness before they're at that point of crisis. In terms of those at risk, we're not going to always be able to capture everybody. That's a long list. One thing that has come up as around employability. So like I've just been redrafting the strategy and around making sure that those that are in temporary forms of accommodation or that are in, you know, or and maybe having to move out of area still have that access to employment where possible, so that they don't risk that kind of potential falling into the trap of homelessness again. Just in terms of working with organisations, there is a lot of different organisations that we do currently work with. But is there any particular groups that you think are particularly at risk that we're not capturing?
I was wondering if you were picking up people who are appearing in court, you know, for eviction.
Yeah.
And so, for instance, you could take an organisation like Citizens Advice who might be there, you know, sort of doing the prevention process in order to prevent somebody being evicted. And do you then, you know, sort of contact those people into your, you know, sort of other support, etc.?
I think the other thing as well is we do have a prevention group that is both statutory and non-statutory organisations. So we have our commission providers and then our statutory providers around that table, and they do monitor trends. So there could be people that they're saying we're suddenly seeing an influx of this particular group. Why do we think we're maybe seeing that? You know, is it people, you know, newly arrived into the community or those kind of things? So we do flag those things as they come up and then work with our providers to address that. So, well, where could you be going and doing outreach to those people? You know, which services could you be going into? That doesn't mean we're always going to catch everyone, but we do have those mechanisms in place to reach those individuals, if that's reassuring.
Michelle?
No, thank you. And I think you're obviously doing some really great work because you are really bucking the trends nationally, because I was just reading a report the other day where saying, you know, homelessness is going up nationally. So something that's working really well, and it's probably more lots of different things rather than one single thing. My only question was, and it might be outside this strategy, but do we follow up people to see whether they maintain, you know, occupation and living in, you know, not becoming homeless again? I just wondered whether we follow people up over any time to see how well people do.
That would be generally something that would be district to district in the city, because that would come under, so if once we found someone accommodation, that would generally be through the individual district or city would do that, and then they would, that would have their sort of own processes. What we do map as a system though are the returners and the repeat homelessness. So while we don't necessarily, I can't really comment on, you know, whether how many people get contacted in a few months to find out how they're getting on. What we do map is to make, you know, why is there a reason why this person is returning to the street, and we talked about in my little you know, introduction thing, we talked about the work with social care, for instance, because, you know, there's people who are vulnerable and have got complex needs won't just be known to the local housing authority. They're likely to be known to all sorts of statutory agencies and some voluntary ones as well. So, you know, it won't be uncommon for us to have individuals that have been evicted from 3 or 4 different pathways, and we're obviously then sort of struggling to, you know, to assist them. So it's those repeat. The repeat sleepers and the repeat people into the system is sort of what we particularly track more than the successful outcomes, which is, you know, it's a fair point.
I do want to say though is we do engage a lot with individuals around co-production or those that are experts by experience. So I'm not saying that everybody who's involved in a service that we always bring them back, but we do engage those people and hear, you know, what worked well for them, what did they really struggle with, you know, did they feel they accessed enough support after they left accommodation when they were kind of in their own tenancy or whatever.
Yeah, that's helpful. Thank you.
Okay, so thank you, and for seeing us in December today, and hopefully again December, January. I think from me, what I'm trying to translate is all of the good work that's very evidently going on, and what does this actually mean, you know, in granular terms, right? So what I'd be hoping for when you return to us at the end of this year is, can we have a direct year-on-year comparison, the state of the nation, you know, in Oxfordshire, what does homelessness look like last December, the first time that we all spoke? And then what does it look like a year on with all of the good work that have been taking place? But, you know, lots of detail in there. So I know that, you know, we've got lots of categories, right? We've got, you know, rough sleeping, which would be the most crisis point. And then we've got people sofa surfing. I don't know how we measure that, but I should imagine you'll have some, you know, some level of data or some level of oversight on this, and then all the other, you know, categories thereafter. And the piece that I'm interested in as well is the people that aren't homeless today but have been served eviction notices and don't have anywhere to go on to, so and they don't have a wage that means that they can readily find themselves a solution. So they're about to reach crisis, and I can think of somebody right now that is currently in this place, and your teams are working with this person. I'm grateful for that, but that person isn't technically homeless at the moment, but it's something that, you know, there's a lot of work that's underway, and I'd like to know that between December last year and December this year, you know, how much of a dent have we been able to make in there? So that's my first request. And then there's, yeah, please.
So I think yeah, we need to be really clear, and I think this is probably something that we take out as officers, because I think, as we've heard today, sometimes the, you know, homelessness by nature does go up and down. So sometimes we've been comparing apples and pears. I think what you're saying is that we want to be in the position to be able to show the impact of the work that we're doing as a system. And I think one of the things which we did describe at the last Health and Wellbeing Board is there is an opportunity, whatever we land in LGR, this is one area where I think it will be easier with services being, you know, hosted under 1, 2 or 3 authorities in that particular area. But we you know, as a system, which is something that we're looking at the moment, we spend a lot of money on homelessness. How do we make sure that we're getting a return for our investment? But I think there is also some risks associated with that, which we discussed last time, which I think it's important to share again. Under the Better Care Fund, there is money attributed to homelessness, and we're still again, like we did this year, quite often some of this funding in this area is year-on-year funding. So we need, as probably at the beginning part of next year, we'd be in a better position to know what that does look like. But appreciating what you're saying, but I think there is something around, do we take this offline and look at exploring it further? Because I don't want to be, from the homelessness perspective, be in a position where we're going to be taking away actions that I know we're not going to be able to comment on. Thank you.
So yeah, so thank you, Karen. So I hear the concern. I imagine the concern is the fact that it's a very fluid picture, right? So it is possible for there to be an increase in homelessness, but actually we'd be better in this space because we've got lots of people doing lots of good things. So I think it's possible for us to be able to, you know, qualify the data and reach a reasoned position. My intention here is that, you know, the Health and Wellbeing Board can provide assurance, you know, to outside partners and to full council that we've got a very good programme here. We've got a very good group of people that are very effective because we've seen the data, we've analysed it, and we know what's going on. So I think it's possible for us to be able to have that discussion.
Agreed, but I think that's where we need to be really clear about the parameter of that discussion to make sure that the Health and Wellbeing Board are getting what they need from that.
I think we're in agreement. Good. And then, so the other piece I wanted to touch on as well is the fact that it's such a complicated geography that you guys are working in, which is we've got so many different councils to start off with that you're working in between, and then within there we've got different service areas, and, you know, hopefully the Prevention of Homelessness Directors Group has all of the support that it needs, but I bet there's more that, you know, we could be doing to support this group, and I'd be really interested to know, you know, what that is very specifically, you know, so I can think of, you know, not only if we've got all of the districts in the city council, and then we've got the county council, then within the county council we've got adult social care that looks after a large proportion of the homelessness, then within children's services we've got YPSA. I would like to have a level of assurance that you know, the directors of Prevention of Homelessness Directors Group is happy with the way that YPSA is currently operating, or, you know, actually if there's more that we could be doing in the space, I'd like to hear that as the cabinet member for children and young people. So this is such a complicated landscape, and ultimately we will all want you to be as successful as possible. I would like to know what it is that you would need, either from Health and Wellbeing Board or from within the complicated structure that you currently operate within.
And can I come back? Agreed, and we are in agreement, but I think this is why we need to have this conversation offline about what those parameters are. So for the health and for the homelessness directors group, I suppose it's about, and again, it's about how we live, we link in with quality and assurance, because wouldn't be the homeless directors group to actually, confirm to either Lisa or myself that, give that assurance. Giving the assurance is based on the data, the outcomes, and the parameters of what we're discussing. So I think we need to be really careful about what we're asking us to do. Hence why I think it'd be great to have this conversation and to agree the parameters of what you would like to come back as the Health and Wellbeing Board Chair to the next meeting.
Again, I think we agree. Was you going to come in on, Richard?
All I was going to say was, obviously, I'll share your comments with Caroline Green, who obviously chairs the Prevention of Homeless Directors Group, and say that that's the sort of, but obviously Karen sort of come in with the way forward. So yeah, we'll obviously take that offline as she says.
Were there any other no more hands up? So in which case then we're being asked to note the report and update. Noted. Agreed. We look forward to seeing you at the end of the year. Thank you. That takes us to agenda item 10, report from Health Watch Oxfordshire.
Okay, so Veronica sends her apologies, so it's not her who's doing the presentation today, but I'll try and sort of fill in for her as best as I can. So Kate has already talked about our work speaking to people from rural communities, where we heard from 851 people across the 14 rural settlements in partnership with Community First Oxfordshire, as a part of the Marmot focus on health inequalities. And more detailed information will come to the Health and Wellbeing Board, I believe, in the September meeting, so where we'll be able to tell you more about the outcomes from that. Hot off the presses this week is our report on people's experience of palliative care and end-of-life care in Oxfordshire. And I just thought it might be interesting to sort of inform you of some of the key findings that have come out of that report. So people would overwhelmingly prefer to die at home or in a hospice compared to a hospital or home or a care home. Though the reasons why reflected a lack of awareness about hospice at home and hospital to home services. So that was an interesting point that came out. It was important to most people to be able to choose what happens with their care, get care and support at the right time, have help to manage symptoms and be kept informed. And we also heard about dignity, respect, having loved ones around, feeling safe and being in familiar surroundings. Highlighted the importance of emotional support and companionship as well as medical support. And there were fears around dying alone, wishes not being respected, and cultural needs not being met, particularly within the Muslim community. 23% of those we heard from said they hadn't made any plans for end of life. Reasons included being too busy, not wanting to think about it, or not sure when to talk about it, or what the options were. Only 30% of the people we spoke to had actually heard of respect, and the only one person had actually put in place a respect plan. And I think that's sort of slightly concerning because the ICB has now implemented respect throughout Oxfordshire, and it's something as well that is causing some problems when people go into acute care and respect forms are not in place and have to be done when somebody comes into a hospital at that acute point. There's need for more widely available information and professionals be better equipped to have holistic early conversations about end-of-life planning, not just treatment options. And there was praise for the responsive and well-coordinated care, being kept informed, families being involved in compassionate care, but obviously we heard about challenges around access to the quality of care, especially where this is predominantly social care, particularly for people with dementia. There was lack of joined up work between services and continuity within services, from the handover from the palliative care team to the social care providers, for example, and lack of culturally appropriate care for instance, skin and hair care amongst older Black populations. So there's a lot of interesting information that's coming out. And if you want to read that report, it is available on our website, so you can just go and have a look. We continue to work with the seldom heard groups, and we've been working recently to get feedback and information about experiences of healthcare from the Chinese community, particularly older Chinese people. And we've been working with a trusted member of that community to speak to those people and gather their experiences. We've also been working with the Black women in maternity to find out their experiences of maternity care. And we've also been working closely with the Sunrise Multicultural Project about breast health and screening, which has led to some bringing members of that community into meetings with specialists who've been able to sort of teach and train people so that they understand better about breast health. We've published our how-to guide for community research, where we've worked with grassroots groups, and we were now working with the Oxford Community Research Group to develop training, which will be rolling out alongside that how-to guide. And the great thing about how-to guide is that it has actually been produced with grassroots community organisations, and their input into it is so important, because the guide is focused at helping those people in the future if they want to do any community research of their own. So we're really excited about rolling out the training and working more with those people. So I think that's a sort of whistle-stop tour through what we've been doing, and I'm happy to take any questions if anybody's got any.
Thank you very much. Councillor Heritage.
Thank you very much. I always enjoy Health Watch's reports, and very much enjoyed the report at the last HIB meeting as well. I just wanted to jump on, I'm always fascinated by any reports on palliative care. Personally, I feel it's an area that of great importance that, you know, in many arenas isn't touched on as often as it should be. So I kind of jumped when you said it was reported that many people you spoke to didn't have a plan for end of life care. I don't have a plan for end of life care. At what point? I'm curious. You know, I'm genuine. How do patients hear about respect? This is, you know, you've just introduced the subject to me, so I'm just curious about that. At what point do you ask people? Do you have a, you know, were you asking patients who were in who might require palliative care, or were these?
There was a whole sort of across the board, you know, sort of discussions that went on, speaking to individuals, but also focus groups, etc., to get that information in. The thing is that I think we're all at a certain age, you know, you kind of think, oh, we don't want to be talking about what we would like to happen to us when we die, or whether we get really ill. And but the whole sort of process of respect is around normally a GP having a in-length conversation with a patient about what their end of life choices might be. And maybe Michelle might be able to answer better than I can about when's the appropriate time for that to take place.
Sorry about that. So RESPECT stands for Recommended Summary Plan for Emergency Care and Treatment. And you're right, it has been rolled out across the Thames Valley, but has only just arrived in Oxfordshire because it's taken some time for OUH to flow its data into the Thames Valley Share Care record. So it's only now in the last month that the GPs are starting to sign up to use RESPECT. Prior to that, we used to use the DNA CPR forms alongside care plans. It's really individual as to when you start talking about end-of-life care plans for a particular person. Obviously, if someone is to receive a terminal diagnosis, then that would be a point to start to talk about what matters to them. And, you know, the GPs look after the care homes across Oxfordshire, And one of the things that we do regularly is review the care plans, and those care plans now will be morphing over to respect forms gradually, with having a care plan alongside that. But the advantage of the respect form now and the Thames Valley Shared Care Record is that instead of it being solely in the GP records, it's done on the Thames Valley Shared Care Record. So anybody, health and hopefully soon social care, will have access to that form and can update it as the person's wishes change, or what matters to them and their needs, change as they move along their life course. So I think it's very individual, and some people, even as they receive a terminal diagnosis, do not want to talk about what happens towards the end, and so it's just meeting the person at the right time. Other people will come in and who are fit and well, who will want to talk to you about their wishes. So it's very individualist. I would also say that respect forms are not, it's not just GPs that can do a respect form. Our community teams are now all trained to do respect forms. As I say, that training's just been rolled out. I don't know whether Grant will have anything to say about that, but they've just all received their training. We have the Sue Ryder teams and Sober House teams, and also all the clinicians within OUH and the wider community trust are able to have these conversations. And it's really important that it's led by the person and when they're ready.
Can I ask Chris if the platform is actually available now for hosting a single respect form that can be shared?
That's what I was saying, the Thames Valley Shared Care Record, it's just there. We've just received the training, and the GPs are starting to do their first 1 or 2 forms.
Thank you. Because I was, it's probably a little bit off topic in a way, but I just think it's really important. We write a will, we say what we'd like to happen to our body. We write we do a power of lasting attorney. But I think this is equally important, if not more important, to in many ways. And I think it's really important that message. That knowledge is passed through the system. So
and I think it's really important that the respect form can be updated and changed, because people will change their mind about what they would like as end of life care, and so that's the ideal of having a single platform where the respect form can be hosted. And what other thing that's really important is that the patients themselves have a copy of the respect form, so that if the ambulance service comes, they can be given the respect form, and they can act on those wishes. Yeah.
Any other member questions? No. Okay. Thank you very much. That takes us to agenda item 11, reports from partnership boards, and I think Chris is going to kick us off with a place-based partnership update.
Main part of this update comprises latest status on the Thames Valley Integrated Care Board's operating model, which I'm just trying to draw up right now. So Thames Valley Integrated Care Board has been in existence for little over 3 months now, and some progress has been made in terms of developing new structures, new operating model, and new ways of working. I believe members and officers should soon be in receipt of some communications as to some documented communications as to what they look like. As you know, Thames Valley Integrated Care Board has been established as a strategic commissioning organisation, so focus is increasingly on improving population health, tackling health inequalities, understanding what our communities need, and making sure NHS resources are used in the best possible way to achieve that. In recent months, we have been consulting with staff and partners on the design of the organisation, and we have received a significant amount of thoughtful and constructive feedback. Some changes have been made to the initial structures and operating model upon which we were consulting and seeking engagement. And last week, the outcome of that consultation was shared with staff, and it was set out in the new structure, as I say, which does somewhat differ to the original model that was consulted upon. So I think over coming months, we'll be establishing new governance arrangements and committees, and also completing recruitment and selection processes into the new structure to ensure that there are clear points of contact for partners. I think it's also important to acknowledge that this remains a period of change for many colleagues. Whilst we are making good progress, some staff are still experiencing uncertainty as appointments are finalised, and just ask that partners are mindful of that during the transition period. But overall, good progress made in terms of the operating model and new structure, and looking forward to continuing that alongside partners as well.
Thank you very much. Any questions on that report? No. In which case then, I've lost my notes. Georgina, Councillor Heritage, you're going to help us with the Housing Improvement Board update.
Thank you, Chair. I'll try not to make it too long. I know it. So our Health Improvement Board meeting was on the 25th of June. It was a particularly interesting one, actually partly because it was during the last heat wave. So it was the first one to be held online, and I have to admit, I did wonder afterwards if my little home office was, if it was a mistake, if it was actually hotter than this room would have been. But I was wrong. This room's very hot too. So, but it was also particularly interesting because due to the agenda. So I'm really sorry that Kate Holborn wasn't able to present and be part of the meeting, because she put so much work into a really interesting and coordinated agenda. But I would like to just mention my sincere thanks to Derris Pragnell, who stepped into Kate's role and was a great support throughout the meeting planning. And I also just want to briefly mention past members as well, because Councillor Chui Monkonge has been a very active member who made a hugely valuable contribution since I've been involved. And he's now stepped down, and I'm sure that his replacement, Councillor Mark Ligo, will be equally engaged. And Councillor Rachel Crouch has been a great support to me since taking on the deputy chair role, and I'd like to thank her for that, as well as welcome Councillor Sandra Coleman to the board. So to get onto the agenda. So as well as other performance indicators relating to our priorities and a wider Health Watch report, there was something of a golden thread in our meeting, which was really sort of mental health and dependency in different forms and the wider implications. And a brand new area of responsibility for us is gambling harm reduction, which all members agreed it's extremely appropriate and relevant to the work and priorities of Health Improvement Board. It's appropriate to the work of district councils, and it's a social problem that should be addressed in line with other dependencies. So gambling harm is now recognised as a significant public health issue. Gambling related harm has links with mental health problems, suicide risk, financial hardship, domestic abuse, drug and alcohol misuse. And in Oxfordshire, a county-wide joint strategic needs assessment for gambling harms was published in 2024. And at the HIB meeting, this new area of responsibility was presented to us with the invitation for city and district councils to offer input. So Oxfordshire has received funding to support gambling harm prevention activity, and a key requirement of the funding is completion of a local gambling harms health needs assessment, which will inform the future prevention activity. So the proposed approach is to develop a county-wide prevention programme, to undertake a local needs assessment, build partnerships with district councils and voluntary organisations, and integrate gambling harms into wider prevention and wellbeing work streams. Councillors were also asked to think about what levers our authorities have regarding gambling. The expectation though really is that this is likely to be mainly physical gambling venues via licensing rather than online. Other actions focus on data gathering and education, including an elected members' engagement plan to raise awareness of gambling harms. And it was agreed that city and district members would put forward relevant officer contacts from our councils, and an initial meeting on this will be scheduled in September. So that was very interesting introduction to this new priority for us, this new area of responsibility, and also giving us lots of interaction. So also relating to dependencies, we received a report on reducing harm caused by alcohol and drugs. This is the strategy resulting from the recent needs assessment in that area. The purpose of this report was to review the current burden of drug and alcohol harm and seek support for the strategic direction of the new Oxfordshire drug and alcohol strategy. The key findings were that Oxfordshire performs better than national averages in many treatment indicators, although significant unmet need remains, particularly for alcohol dependence. And the number of adults accessing treatment for alcohol and/or drug use in Oxfordshire has increased significantly since 2020, though the numbers of children and young people accessing treatment have fallen. Significant harm remains, particularly among people living in deprivation, people with mental health conditions, people experiencing homelessness, and other inclusion health groups. And yeah, unmet need remains substantial for alcohol dependence. So the proposed strategic priorities are to address the underlying causes, reduce supply-related harms, strengthen prevention and early intervention, and improve treatment and harm reduction, and support recovery and sustained well-being. So there were lots of questions asked and areas to address around this. For example, how we can best utilise the perhaps the strategic opportunities through presented by LGR, Marmotplace, neighbourhood health plans, and so on. How partners can strengthen links between substance use, mental health, housing and homelessness, criminal justice, gambling. So there are lots of I suppose discussion prompts, if you like, and areas of discussion for our group, both at the time and to take forward. So it's interestingly. So it was interesting to note actually that in the performance indicator reports, indicators for alcohol are tracking green in Oxfordshire, but we also discussed the prevalence of alcohol behind closed doors and the way this basically socially acceptable drug can creep up on people as a problem. So interestingly, Healthwatch also noted their recent rural Marmot work showed there's a big link between lack of facilities and activities for rural teens and drug and alcohol use. So it's an area ripe for prevention work. I won't comment too much on Healthwatch's very thorough reports. Some areas you've mentioned today. But I will say, linked to our agenda item on mental health, there was a report on people's experiences of mental health services heard from people who've had long waits and difficulties accessing appropriate services, although there were some positive experiences as well. Healthwatch, again, is relevant to our discussion points, looking at the wealth of community groups supporting health and well-being in rural areas, and the gaps around transport, housing, and provision for young people in our rural communities. But Healthwatch there's always so much to comment on, and I always appreciate your contributions. And then finally, we had the mental health item, which was presented by Bhavna, who was in the room with us earlier on an agenda item, who focused on the vital keystone hubs in Oxfordshire. And this is an item that we very much look forward to seeing again on our agenda. So I kind of raced through that a little bit, but I am conscious I can talk too much sometimes. But I will say that despite the heat and the online nature of Health Improvement Board, I think the meeting was lively. There was a great deal of opportunity to engage, to interact, and to help shape strategies for the greater well-being of our Oxfordshire communities. And just like to take the opportunity to thank everyone involved for their excellent contributions. Thank you.
As ever, very comprehensive report. Thank you. Any questions? No. Chris, your mic is still on. Just noticed. Apologies. That's right. My update from the Children's Trust Board. Health and Wellbeing Boards have given permission for the Children's Trust Board to, in effect, own the Best Start in Life plan, which will be brilliant for the Children's Trust Board if it goes well. They might not be that happy with me if it doesn't. We've got in place some very, very ambitious targets, in particular for good level of development, which is where our 5-year-olds will start primary school ready to learn. If I think back to when I'd first arrived in post, and one of the first school visits I had, and one of the first discussions I had with one of our Senkos in Oxfordshire, she said to me that her request and her plea from us at the county council and the wider partnership was to do as much as we could in the space of school readiness. And she was talking to me about examples of children that aren't in a position where they're ready to learn because there are still some basic life skills that we haven't reached by that point. So it meant that inevitably a number of children were behind the pace. And I think we're at a place now that, not only have we taken that literally on, and we've put in place some very ambitious targets, and through a number of discussions both in Health and Wellbeing Board and in Children's Trust Board, we've seen a glaring unacceptable inequality between the school readiness from all of the children and a much lower level for those children in receipt of free school meals. So we've set in place a target that we will not only improve the good level of development for all of our children, but improve those children in receipt of free school meals at such a rate that they will improve, and we will close the gap from 30% to 20%. So that's the good bit. Now what we've started working on in Children's Trust Board is how are we going to do this? What are the actual actions that as a team we can take? And we've got a rolling agenda item. So every Children's Trust Board will have the Best Start in Life plan as an agenda item. And my questions are, as chair of the Children's Trust Board, what has happened in between the last Children's Trust Board to now in the space of good level of development and the Best Start in Life plan? What are we currently planning on next, and what do we need collectively as a partnership in order to be as successful as possible? And like we was talking earlier about the all-age autism strategy coming back to us in a year's time, so the Health and Wellbeing Board can get a real sense of, we know that we went into it with the right intentions. What does the delivery actually look like? I'm really looking forward to the Best Start in Life plan coming back to the Health and Wellbeing Board, sort of a year after this grand ambition being baked in, to be able to report back how it's currently doing. The initial signs are unbelievably good. It's really exciting where we're currently up to. So I'm really pleased that the Health and Wellbeing Board have given this task to the Children's Trust Board, and my commitment to the Health and Wellbeing Board will be that the Children's Trust Board will take its responsibilities very, very seriously and will be very committed to making sure that Best Start in Life plan is as successful as possible, and anything else that we choose to sink our teeth into. So I'm happy to take any questions if there are any. Otherwise, that takes us to agenda item 12, which is the forward work plan.
Chairman. Is the committee happy to note the Children's Trust Board update?
Are the committee happy to note my report? Thank you. Right. I like to jump ahead. Right, forward work plan. This is important for us to make sure that we're happy with what's on the forward work plan, because I very much see that future agenda items will be plucked from the forward work plan. So I don't see agenda setting meetings being what the chair wants. I see the agenda setting meetings being, what does the board want to sink its teeth into, and it needs to come from the forward work plan. So hopefully it's reflective of what the board would like to look at future meetings. If it isn't, then please do let me know, and I will make sure that future agendas look like the very things that the board members would like to sink our teeth into. So I think we're being asked to note the forward work programme. I've got permission to note.
Sorry to interject here. I'm always happy to delegate to myself and Kate Holborn, alongside in consultation with the chair, to make any minor amendments as might be necessary offline to the forward work plan.
So yeah, so permission to delegate to me is step one, and then also an open invitation if anybody would like to speak with me about what the forward work plan looks like. So that way we can genuinely make sure that the agenda setting meetings reflect what the board would like to look at. I think we're all in agreement. Good. I will close the meeting 10 minutes early. Well done.
Thank you.